Welcome everyone. Welcome to today's event. My name is Erin Adams, and I'm the Vice President of Human Resources here at the Globe and Mail. And I want to welcome everyone who's in the room to this event, as well as everyone that's joining us virtually from across Canada. So glad that you can make it for today. Before we get started, I wanted to acknowledge that the Globe and Mail's headquarters is situated on the traditional territory of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. My colleagues and I are grateful for the opportunity to live and work on this land. So on behalf of the Globe and Mail, I'd also like to thank Sun Life for making today's event possible. Over the next few hours, we're going to be talking about women's health at work, and I'm sure we can all agree that we haven't talked enough about it, and it's been in the shadows for too many decades. So it's nice to see the event and how well attended it is. And the fact that we don't talk about it, I think, has been a real detriment to women, as well as to employers and businesses in general. So it's great to see that we are starting to talk about it. We're starting to bring it out of the shadows, and we hopefully will continue to do so. So here at the Globe, we recognize that women's health and well-being can impact personal lives as well as work lives. And so with that in mind, over the past couple of months, we've been introducing new policies to support women at work. And when we're introducing these policies, the intent is to educate people, so to educate staff, to educate managers, educate colleagues, and really try and reduce the stigma on some of the issues so that people feel safe talking about it, whether they're talking about it with their colleagues or their managers, to know that this is a safe environment. And so last year at this time, we introduced a new menopause policy. And normally when I send out policies, there's not a lot of feedback. I'm not sure that anyone reads our policies, but when we sent out the menopause policy, we had such a positive reaction. And it was really nice to see. Women were thrilled that the Globe had taken a step forward and actually had started the conversation. And so our policy is, again, it's educational. It kind of talks about symptoms, how they can show up at work, and it also gives some suggestions to managers and staff on how we can kind of work with those at work. Nothing earth-shattering, no special accommodation for people, just unless they medically need it. It's just kind of ideas, and it really is to start the conversation and to encourage people to have the conversation. We also introduced an intimate partner violence policy. We already had a violence at work policy, but it was really about if the violence comes to the workplace, how you make sure that everyone stays safe. It doesn't talk about people who are dealing with this in their personal lives and how that can translate to the workplace. So again, to try and reduce the stigma, try and encourage people to be able to talk about it. Just last month, we introduced a new guideline for new parents returning to the office following a parental or pregnancy leave. And again, we do a lot for people when they come back from LTD or STD, but we don't really do a lot for people when they're coming back from potentially 18 months away from the office. And so that gives suggestions on how you can kind of improve your transition back, make it easier, move your transition back to the workplace. So we hope that these types of policies can really encourage people to bring their whole selves to work, that they can, your personal life and your work life often are very intertwined. And so by encouraging people to talk about things, that we hope you can bring your whole self to work, you'll be more engaged, you'll be more productive, and that women can stay in the workplace and will stay at the Globe, hopefully. So we hope that the Globe with these policies will be a place where women can thrive. And I think we probably all share that and why we're all here today. So we have an excellent lineup of speakers that are here to share their stories and their insights. After the program, there's going to be a reception that takes place just outside where the food was before, so I encourage everybody to stay, network, make some new connections. And then we're ready to get started with today's program. So it's my pleasure to introduce our first speaker, who will provide some context on the gender health gap in the workplace. And I will welcome Lisa Witczek to the stage. Lisa is a partner with McKinsey and Company and also the chair of McKinsey Canada's Diversity, Equity, and Inclusion Committee. Welcome.
Thank you. Thank you so much, Anna. Well, thank you so much for having me. Is mic working? Okay, fantastic. So warm welcome to the event. And it couldn't be better place and time to speak about women's health. It is a personal and professional passion of mine. And I'm Lisa Witczek. I'm a partner here in Toronto with McKinsey. And I serve my clients on the customer-centric growth. And I lead a lot of women's health initiatives with our clients and within our company. It is a fantastic time to be a woman, and it is a fantastic time to be in Canada. That's all I say. So today is a really strong lineup of presenters and speakers, and this is an incredible group who can really move not just a needle but a mountain in our own respective organizations. And I will kick us off with talking about some research about closing women's health gap. And we partnered with World Economic Forum, and around 10 months ago, we brought to life a report in the WEF Forum in Davos that talked about $1 trillion opportunity gap. And I'm really pleased today that I can bring not just global insights, but our Canadian insights and Canadian data to make it really relevant and contextual for our respective companies. So we did this collaboration, and it's been an amazing journey for me personally in the past 10 months. Not only we started new partnerships and created alliances, there were billions of dollars pledged towards women's health globally. Also, Oprah tweeted some of our slides, which was absolutely fantastic. But it's also started very important conversations and just how little we are spending time on women's health altogether talking about it. One very, very important acknowledgement that I will be talking about women, but this is really a cisgender women or female-bodied biology that we're discussing. There is a tremendous lack of research in how the non-binary or gender diverse and gender fluid communities is experiencing the health gap, and it is required to be studied. For now, the only data that we have is on women. So we went about it in a very rigorous and kind of robust fashion. We analyzed hundreds of different academic paper results and interventions that are proposed as a treatments. We looked at the conditions that constitute the majority of the global women's health disease burden. And we also substituted it with interviews. And for a field that is kind of science-based and health-based, there are a lot of myths that are prevailing here. And we will be talking about this myth today, but also what we do when we move forward and what is the path there. And the data itself, one of the big findings is that it's absolutely inadequate, but we're building with what we have. So let's kind of start with a myth here. We often hear that women live longer than men, so they must be healthier. In fact, it is not true. The women have, and I will add small pause. Can we check that this is the right presentation, Rochelle? I think this is a US data, but we will adapt if we need to. So women, it's true that in the past 2 centuries, we have the women's health, like the span of life has increased a lot by around 30 years. But in reality, women spend quarter of time, 25% more time, and for Canada, this number is 24% more time in debilitating health or poor health conditions than men. Which means this is not just a statistics. It is life years taken away from being active and healthy and pursuing our dreams and careers. The myth number 2 is that the women's health gap is really concentrated at the end of life. So we are imagining someone who is very aging and frail, and that's when the women's health gap is hitting us. In reality, 2/3 of the years that we are losing are in primes of our lives. It is between the ages of 20 and 60, and the majority of GDP gap comes from it as well. Which also means that it is really important for us as employers, for us as the team leaders, to consider how it impacts the workplace. It is not somewhere at the kind of end of life stage, it's really the prime of our careers and times. So myth number 3, that it's all about sexual health and reproductive health. In reality, mere 5% of the health burden that women experience are from women-specific conditions. Everything else affects both women and men, but we are in some or the other way disadvantaged when we are receiving the care. So in our research, we kind of split all the diseases into several buckets. We looked at women-specific conditions, things like menopause or endometriosis, and this is just mere 5%. The majority comes from conditions that affect women disproportionately. For example, 80% of the autoimmune cases are in women, which means that research into it would really aid and help support the women's health cause. There are another set of conditions that affect women disproportionately and differently. And these are the kind of examples could be the heart stroke. In Canada, a woman is 7 times more likely to be discharged during a heart attack. Why? Because all textbooks are written for men. It is about the symptoms and like representation, and the treatment is also written for men. And it's all about like hard chest stomping and really kind of acute pain, while for a woman it might be a headache or it might be an intermittent pain that just is not read in our healthcare system. Few more observations on like what is really interesting about those diseases. A lot of diseases that affect women disproportionately don't lead to mortality. They actually lead to prolonged disability. And I'll just pause to sink it in. It means that we are living and suffering for a longer time, and it also jives with this 25% more kind of time in debilitating health. Myth number 4, that women's health is a niche market opportunity. This always blows my mind. 1, we are 51% of the population. 2, we are more than 85% of medical decisions are made by women. So we are chief medical officers of our families. But still, somehow there is like this lingering, persistent kind of thought that there is something that is kind of niche about it. If we start putting facts to the table, let's take endometriosis, for example. This is a condition that affects 1 in 10 women in Canada. And globally, it sums up to roughly 400 million women that are affected by endometriosis. And there are only about 20 assets that are in the pipeline. If we take it and compare it to diabetes, which is also 1 in 10 adults, we have 30 times more assets that are in the pipeline. So that's really underestimates and undervalues the potential of the women health-related opportunities here. So what are the reasons? For a science-based field like healthcare, there are quite a lot of gaps and quite a lot of what is driving it. So we looked at the whys and the causes, and this is pretty consistent across the countries. The first one is that there is a very limited understanding of sex-based differences. 50% of the drugs and treatments, they do not have sex disaggregated data. And for the 50% that there is sex disaggregated data, 2/3 disadvantage women. And there is generally this prevailing sense that women are small men. There is no difference. We just take the man, shrink it down a bit, like maybe kind of some proportions here and there, but that's it. And it was only in 1997 in Canada that women were mandated to be included in trials, less than 30 years ago. Women are complex. We have our cycles, hormones, everything. It's much more difficult to make a treatment work for us. And it took another almost 15 years to mandate reporting the sex disaggregated data. So majority of the treatments that are on the market today were never tested on women or were tested but not reported separately. The second one is the constrained access to sex-appropriate care. And we know that women face barriers in time to diagnosis, in being able to get the right treatment, and even when the treatment is there on the market and proven. The data gaps. And more than 80% of women never get tested for menopause. They never receive treatment. And for what we know, 100% of women who reach a certain age, they will be going through menopause. And this sends all the wrong signals. And all the three reasons, they all culminate in very low investment. Less than 1% of global funding goes to women's health, out of all the healthcare spend. And in Canada, around 4% of the government funding goes to women's health. So there is if you're outraged by now, I'm with you. I'm with you. It's like when we started looking at the data, it has been surreal. And it feels like some of our fears and kind of hopes are validated or disvalidated. But I have a good message, and I have a silver lining message here, that actually there is a tremendous opportunity. This slide shows a global $1 trillion GDP opportunity. For Canada, it is $27 billion, which equates around 2% of GDP per capita increase for every single woman. This is a tremendous number. What's even more encouraging is that it's a very wise investment. Each dollar invested in women's health pays around $3 back. So there is no reason, no logical reason not to invest in women's health. So what do we do? Where do we go from here? There are 6 actions that we came up with, but the more important realization is that it is only an ecosystem of stakeholders that can truly drive the change here. That we cannot act as single individuals and hope, or even single companies or single industries, and hope that things will come together. And it all starts with awareness, awareness, awareness. If you all take one fact that really kind of stuck with you today and repeat it to 5 friends and 20 colleagues, that would be excellent. 2, we want to make sure that there is an appropriate definition of sex care, sex-appropriate care, that we are not just restricting to this 5% of reproductive only. We want to make sure that we collect the right level of data, because without data, the signal does not travel. We want to close the research gaps where they exist and making sure that women's health is as well studied as it should be. Finally, it will take money, so it requires a lot of funding, and making sure that the government is supporting with appropriate policies. Let me bring it to life on this endometriosis example. What if we had a public and private investment partnership that invested in the fundamental research, that then helped to unlock with life sciences companies what is the better treatment, which will be combined with a doctor and frontline training that you actually can recognize the symptoms and doesn't take 10 years to diagnose the endometriosis. Consumer companies can support with wellness and symptom management. There will be kind of a signal going back and more data coming in, which means that investment case will get better. And the opportunity will get bigger. And for this woman who has been gaslighted maybe for 10 years and going to more than a dozen doctor visits to get diagnosed, it will mean she doesn't need to put her hopes and dreams on hold. She can act, and she can be there where she needs to be. And I feel like for the HR and broader team leader, leadership community, that's an important inflection point. If we want more women in workforce and we want more women in leadership, this is the only way out. We just published a couple of months ago another research that it will take 50 years to reach parity in the workplace. And this is the impetus and the grounding of it, because we cannot do that if we are not healthy and we are not kind of taking care of the human as a whole. I have no idea what is the next slide, but if you want to learn more, there is a QR code on our McKinsey Global Health Institute report, which is a longer version of what I just talked about. And I'm personally really eager to continue the conversation today with all of you, or ping me on LinkedIn, whatever suits. And I think I will be, okay. We actually do have some kind of specific insights, but maybe it's for another time. Okay. I will be passing on to Rita. Yes, thank you. Thank you so much, thank you. Thank you. I will.
Oh, no, I think that's yours. Great. Thank you, Lisa. What a great way to set the stage for today's very important event. Hello, everyone. My name is Rita Tritcher. I'm a senior business writer and columnist here at the Globe and Mail. And I have to say, it's been very encouraging for me to observe how companies have reconsidered women's health as a business issue. It's really encouraging. As I was telling my 14-year-old daughter, get all the information you can about your body so you can make informed choices. And, as a middle-aged woman who has been menstruating for 38 years, I gotta tell you, I am so done with social stigma. So done. Gen X women are done. So we just heard some interesting insights and data related to the gender health gap at work. Next up, we have an amazing panel discussion featuring some of the women who have actually navigated many of these health challenges. So let us welcome them to the stage. First up, we have Shauna Mueller, Client Success Manager with Ready Set. Come on up. Next on our panel is Denise Campbell, Director and Canada-wide Ambassador Program Coordinator with the Endometriosis Network of Canada. Welcome. And last but certainly not least, we have Janet Coe, President and Co-founder of the Menopause Foundation of Canada. Thank you for everyone for joining us today. And I'm just going to take a seat so we can get started. All right. I'd like to start off by asking each of you to share your personal experiences with a health issue at work, just so the audience can get a sense of where each of you are coming from. Denise, could you start?
Yes, for sure. My mic on? Oh, yep, it is. Before I even knew I had endometriosis, of course I was living in a lot of pain. My first interaction with my manager was after a week stay in the hospital in January, returned to work, and I was explaining to my manager that I was in the hospital. I had a collapsed lung and fluid in the lung. And then she stopped me and she said, "Oh, it's probably pneumonia." So I was like, "Oh, okay." I wanted to share. Thanks for diagnosing me. So I didn't get to share anything else because I felt like you just told me and fanned it off and wasn't interested. And then she said I went over my allotted sick days and I'm going to be put on a attendance management plan. So I was devastated because I thought it was like punitive. She's like, "No, it's not punitive. We just want to make sure, we monitor your attendance." I said, "Okay, but you want to monitor my attendance, but you don't want to know why." I was ill. No. She retired, great. Then I had another manager. So now that I came out of the hospital, I'm aware that I have many appointments. So one of my first appointments that was priority was another biopsy of my chest. So I went to my manager and I said, I want to talk to you about some medical appointments that I have, upcoming medical appointments that I have. And she says to me, "Oh, Denise, you look great. Just sit down, let's talk." I was like, "Okay, but I want to talk to you about my upcoming medical appointments." And then she stopped me and she said, "We cannot plan our sick days." So I said, "I know, I understand we cannot plan our sick days, but I know I have a biopsy of my chest. I know, 99.9%, I'm not going to be able to come to work tomorrow." or even after I do this biopsy. And then she started to tell me about her grandma who was in the hospital and was ill. So just cut me off, didn't want to hear anything else. And that was the end of our interaction. And I actually had to go to the union to get some support, because in my head, I thought that I was really being proactive and wanting to share just a little bit about what was happening and what the sequence of medical appointments. I was willing to share and just be an open book. This is what's happening: x-rays, CT scans, blood work, thoracentesis, where they have to drain the fluid out of my lungs. Just so many appointments coming up. And it was just like, really? I didn't have the room, the space, even like the empathy of, let's sit down, Denise, let's talk about I'm open to hearing what you want to share. That's what I really wanted my manager to do. Give me time to talk about what is happening for me. What does my attendance look like? What are the supports? What are accommodations available? Nothing was like shared with me. And I'm just sitting there in pain, day to day, going to work.
That sounds like a case study of what not to do as a manager.
Yes.
Okay. All right. I want to bring Shauna into the conversation to share her story. Go ahead.
Thank you. Thanks for sharing that, Denise. I think my mic's on.
Yes.
We're good? Okay. Hey, everyone. I'm Shauna Mueller. And what I bring to this conversation today is over a 4-year journey with infertility at the start of my career. And my husband and I, we did IVF for over 4 years, so navigating doctor's appointments while working full-time and completing my MBA part-time was quite a lot to juggle. We also decided to step away from IVF after it wasn't working and pursued adoption. And we're lucky enough to adopt our son from birth last year. So that in itself was also an amazing experience to go through alongside my employer, because when it comes to adoption, it's not your typical pregnancy path. Once you are on a waiting list, you can be matched kind of at any moment. So we had just under 4 weeks notice for our son coming into the world. And so my manager and the company I'm with, ReadySet, was extremely supportive and gave me my full maternity leave with just that 3 weeks notice. So yeah, so that's what I want to share my view on today. Yeah.
Okay, Janet.
Well, I'm at the other end of the spectrum talking about menopause. So my experience with menopause in the workplace, at the height of my professional career, I was blindsided by menopause, like so many women. I had never heard of the word perimenopause, which is that phase of life that can last 2 to 10 years before you reach menopause. I started to have these symptoms that I had no idea were part of the menopause transition: body aches, joint pain, brain fog, night sweats, and heart palpitations that scared me so much I ended up in the emergency room. Every healthcare practitioner I saw said I was a healthy woman, yet I felt so burnt out and so confused. I left a senior vice president role at the age of 48. Looking back in the rearview mirror, I know that if I had gotten treatment, support, my health and my career trajectory would have looked very different. Sadly, my story is not that unique. And that's one of the reasons why we started the Menopause Foundation of Canada, together with our co-founder, Trish Barbado, an amazing team of women, and also a medical advisory board of the top menopause specialists in the country. We believe that menopause is a health equality issue in Canada. It's a tremendous injustice to women to not be prepared, to not know what's happening. And we also think that we will be the last generation of women to be in the dark about menopause.
Oh, yeah.
All right. Absolutely. Nobody talks about perimenopause. It's actually infuriating. Okay, but the Menopause Foundation has actually, I'm outraged. Nobody talked to me about this. Okay, the Menopause Foundation has studied the impact of perimenopause and menopause at work. Can you share some of those findings? What do women need to know?
Well, the impact is significant. In 2023, we released a report called Menopause and Work in Canada, and that quantified for the first time the staggering $3.5 billion economic impact of these unmanaged symptoms of menopause. So many women, that number, that results in some 540,000 missed days of work, $230 million in lost productivity, and women themselves in their peak earning years leaving money on the table because they're reducing their hours, taking lesser roles, or walking away altogether. So it's a significant challenge. Women in our report do indicate that these unmanaged symptoms are causing them trouble at work, that it's interfering with their performance. And we know that 1 in 2 women feel unprepared for menopause. They don't understand the symptoms. So there's a significant opportunity to make positive change, because what we also need to do is change the conversation and the narrative on menopause from something that is overwhelmingly viewed as negative to what it should be seen as. Women in the prime of their life, at the peak of their careers, with so much to contribute and to give, but you can't feel that way if you're struggling with symptoms you don't understand, and that the healthcare community and the workplace doesn't understand either. So there's lots of opportunity, but that's essentially what the report spoke to, Rita.
Okay, that's great. There's opportunity. There's a chance to change all this. But you do talk about the impact on women. And Denise, I want to come back to you because I want you to discuss a little bit about, for you and your situation, what were some of the impacts on you at work?
Some of the impacts, I think first that I looked like I was struggling, but nobody wanted to approach me or discuss anything with me. My colleagues and my coworkers were like, why are you here? Why are you here? I would continue to go to work. And I think maybe because, firstborn generation of Canadian, my mom came from Jamaica. I just wanted to make sure that no matter what, I'm showing up for work. I'm a hard worker. I'm going to show up to work no matter what. There are times I went to work and I barely could walk because I had sciatica pain. The endometriosis tissues hit the nerves and couldn't walk. It was, if anybody that knows about sciatica, it's quite painful. When I had the biopsy of my chest, probably about 3 weeks later, I was just like crunched over, walking, because I was just like, and holding my chest. And I couldn't walk anymore. And they, like my colleagues, not my manager, because she said she's busy, she had to run into a meeting, called the ambulance so that I could go get some medical treatment, because I actually could not do anything, couldn't walk. So fast forward to having surgery and going on short-term turn to long-term. Because with endometriosis, and you have the treatment, there are side effects. So one of my side effects, the biggest one, is I guess it's called like medical menopause, Lupron. Had the Lupron injection. So I had all of lists the menopause symptoms, including depression. So depression, fatigue, insomnia, couldn't sleep, pain, body pain. So not just pelvic pain because of my menstrual cycle. I had full body pain, lower body, especially my back, couldn't sit at work, brain fog, just having a terrible time. And with that, side effects and taking all these painkillers, and sometimes the medication makes you so sleepy. Like I go to work and I'm tired. I look tired, like I could fall asleep at any moment. My eyes are heavy. So those are just some of the challenges when you're not well. And plus, I'm still investigating what's happening to my body. So I'm still showing up at work, but I still have to go to all these medical appointments, and nobody's even talking to me about accommodations. So it's a difficult time, very difficult.
Shauna, I remember when, I became a mother for the first time, I was really worried about how maternity leave would affect my career trajectory. You had talked to us in preparation for today's event about how it was hard for you to make career decisions while you were undergoing a fertility treatment, something I know nothing about. That hasn't been my experience. Can you talk a little bit about that?
Sure, yes. So for me, the impacts of the fertility journey on my career showed up in that I was always kind of looking for a workplace that was very flexible, had remote opportunities, and had managers and people that I felt I could trust. And at certain points, I also felt it held me back a little bit because I wanted to stay safe, in my current job, maybe not stretch for that role that might require more time, more of a commitment. And also the impacts were just physical around being on medication all the time, timing certain injections and realizing, oh, I have a client call, but I have to inject my body at that time. How am I going to do this? So yeah, there's just a lot to juggle. And then also just the fact that it's very invisible. You look at people walking down the street, you have no idea that they might be going through IVF or menopause or endometriosis. Yeah. It's extremely invisible. And that's just a really heavy burden to carry. So.
Okay, Janet, you talked about the cost to businesses and the economy, but there are also personal costs for women because they have to make decisions about, whether they need to retire early or take leave. And we already know that women don't earn the same level as men for doing the same work. There's the gender pay gap too. Could you talk about some of the costs women have to consider when plotting their next steps, and how do we close these financial gaps for women?
I think like everyone has said, so much of what women experience during menopause, a lot of it is silent, and they're struggling to get help and support because we are in this situation where so many people don't understand the changes, the hormonal shift happening in their own bodies. So our research, as I mentioned, indicates that women in their peak earning years are taking lesser roles, stepping away, reducing their hours. We did some research with the BC Nurses Union, which also indicated that women are self-accommodating by moving away from bedside work. So this not only affects that individual person's health and wellness, it also affects their financial viability. If you are reducing your hours, taking a lesser role, or walking away earlier than you might from your career or from your job. So we do have to take this seriously. Menopause is not just a health issue. It really affects everyone because when that individual woman is not feeling her best, it affects her health, it affects her ability to support her family, both emotionally and financially, and it affects the workplace, as we've seen, and now that we know that it also affects the economy to the tune of $3.5 billion annually. So it's a topic that is so worthy of having this conversation and recognizing that the impacts are far-ranging.
Shauna, I know you have some thoughts on this as well. We all have heard that fertility treatments can be very, very costly. What would have helped?
I guess coverage. Any kind of, benefits to cover treatment would be very helpful. And then just awareness, understanding, education, and creating a safe workplace culture so that employees feel they can share. I also feel, having worked in smaller organizations too, having someone outside of your direct manager that you feel you can confide in can be really helpful as well, because there is a sense when it comes to pregnancy and fertility that I often felt when I shared that maybe a manager would think I was less committed to my role, that I was thinking about going on mat leave, and that wasn't the case at all. So yeah, those are a couple of things.
Okay, and Denise, what about you? You've talked about the lack of empathy and the need for empathy. What else would help?
I remember when I had ongoing appointments. So my doctor said, just go on remote, work from home. I said, yeah, that sounds great. Can you put that in writing? And I'll give it to my manager. And I remember my manager said, with this position, that's impossible. And I said, really? It's a laptop and a phone. I just need to talk to my clients. And funny enough, when she said it was impossible, about a year later, COVID happened. So everybody was with a laptop and a cell phone to connect with their clients. So I'm like, oh, it's not impossible. You could make it work. Why couldn't you make it work for me? Why couldn't it be flexible? Why couldn't you say, you know what, Denise? Because you're trying to return to work, because you want your full salary, because endo is expensive, let's figure out a way. Let's try something different. Let's try, working from home. And it wasn't even, she just shut it down. Just shut it down, impossible. And I look at that letter all the time that my doctor wrote, and I think of, that email that was sent to all my colleagues about, don't come into the office. Everybody's working from home now. And I was like, wow, I wish I had that opportunity. I wish I had that opportunity, because I went on long-term, and it's 66.3% of my income. I do receive my insurance, so I have coverage. I don't have coverage that will completely help with acupuncture, for physiotherapy, pelvic floor physiotherapy, counseling, because you definitely need counseling. My depression of everything that was happening, and then not being able to even talk to my manager for flexibility about remote working, it hits you very hard. And at that time, I was doing all these training programs to go into a management role. And it was just like, you're sick, you're unwell. I don't think you should even look into another position. I don't even think you could handle the position you're currently in. But nobody gave me the opportunity to even try. And I don't understand why that flexibility just wasn't offered. And that encouragement to say, you know what, we want you to stay in the workforce. We want you to stay with our organization. We're going to do whatever we can to help you. And that wasn't the case. So it was very difficult to be exit. And I think because also with endometriosis, people think of menstrual cycle. Oh, she's just talking about her period. Really, is it that bad? It's normal, Everybody has body aches. Everybody has sharp stabbing pain. Everybody feels out of breath, like they're going to pass out. It's no. And if you have all of those symptoms, that is not normal. And it's not just your menstrual cycle. This is a whole full body disease that has impacted me. And that dismissiveness is very difficult. So just having understanding, empathy, flexibility. I like what you said, maybe not talking directly to your manager, but somebody else that is going to listen and support you and create a plan for you to stay in the workforce if that's what you want, right? That would have really helped me.
Yeah, as if women don't face enough barriers in the workplace as it is. Janet, the good thing here, though, is that some workplaces are actually leading the change on this. So I'm hoping you can tell us a little bit about that.
Yeah, we're really excited. When we released our report on menopause and work, we also launched this campaign called Menopause Works Here. The campaign was intended to allow organizations to download free resources on their journey to becoming menopause inclusive. We believe that the workplace is a great opportunity to close the knowledge gap. And we also knew that it wouldn't be a heavy lift for workplaces to make a really big difference. So we're so excited that we've had a number of leading companies join that campaign, including Sun Life and BMO, PwC, L'Oreal Canada, the Arthritis Society. These organizations are recognizing that it is critically important to support people at all stages of life. So this is not about special treatment. This is about recognizing that we have ignored women at the peak of their careers and of their working lives, and we're going to make a change. Some examples of what organizations are doing, and again, our playbook offers them 5 easy steps that they can follow with lots of resources and tips. But I would say Sun Life is really leading the way. And I want to give a special shout out to Helena Pagano, because as their EVP, Chief People Leader and Culture Leader, at a time going back a few years ago when we were talking to organizations and many senior leaders did not want to have this discussion, she stepped up and she just recognized that this was the right thing to do. It was also very important for the business, and just embrace this. So what does it look like to be on your journey to becoming menopause inclusive? It's like at Sun Life, where leadership starts at the top, where you break the taboo and the stigma. Organizations like PwC, they're saying we need to include men in the conversation. They had a big session where their male CEO kicked off a conversation on menopause. They're organizing menopause circles monthly that women are leading to have that empathetic conversation. It's organizations that are doing focus groups and roundtables with women to say, what would be helpful to you? But it's also, like everyone has said here, it's about respect. It's about looking at our benefits programs and recognizing, are we doing enough to support people at this stage of life? What kind of reasonable accommodations might we make? If you're somebody who has to wear a really thick, heavy uniform, can you have a flexible uniform policy? So people are looking for those kinds of reasonable changes. But again, we think this is an exciting opportunity to recognize that people need support at every stage of life. And it really doesn't take a big lift to make a big difference for the people in your organization.
And how do you get the naysayers? How do you address the criticism from the naysayers? What's the best way to do that?
I think the best way to do it is with data. So, when you think about the menopause story, just the reality that 1/4 of the workforce are women over the age of 40. Fastest growing cohort, women between the ages of 45 and 55. Employers cannot afford to lose the talent, expertise, leadership, mentorship of women at that stage of life. And when you actually look at this as we've done, which is not about doing anything in addition to or special, it's just recognizing that we've done this before. We've done this to support people going through pregnancy. We've broken taboos around mental health. This is just supporting people at another stage of life. And I can tell you that most employers have been very open to having that conversation. So we're very excited that I think Canada has this opportunity to lead the way on this conversation.
Okay, Shauna, a big challenge for women going through fertility treatment is what to tell your boss and your colleagues. Especially if you're a younger woman who doesn't have a lot of seniority or job security, not that far along in your career. How did you approach that issue?
Oh, that's an excellent question. It was quite difficult, to be honest. My fertility journey spanned, many different treatments along the way, 7 IVF transfers, which is kind of an opportunity for that to become a full-blown pregnancy. And in all those moments, I really dealt with them by a case-by-case basis with my manager at the time. Often I would decide the day of a treatment, okay, I'm gonna take a sick day. Sometimes I would try to map it out if I felt I could trust and share with my boss. But it was really challenging because I wanted to show that I was committed to my work. But I also had paid a lot of money for this treatment and I was really hoping it would work. But I have to say that the biggest challenge was stepping away from IVF and pursuing adoption and having that conversation with my manager to say, hey, look, when this happens, I'll give you as much notice as I can, but I can't promise that it will be a lot of notice. So.
Okay. One of the things that we keep sort of hearing as we discuss this topic is, it's not just about the workplaces, it's about the care, the medical care that women receive. They need the support, they need the resources, but they really, really need informed physicians who can have an honest conversation about what is going on with them. Denise, I want you to share some of your challenges and views on accessing health care, especially as a Black woman, because you said that was certainly a factor in your experience.
It was, because I went to my doctor several times to let my doctor know about my chest pains, shortness of breath. I can't catch my breath sometimes. And my doctor said, just go and exercise. So I said, okay, I'll exercise. I came back. I said, I'm having some sharp stabbing pain in my pelvic area. I feel like my insides want to come out. I don't know how else I could explain it to you. I'm in so much pain. So I remember my doctor said, okay, I'll give you 5 naproxen. I was like, oh, okay. So that's just gonna help you throughout your menstrual cycle. 5 naproxen. So I filled it, took the naproxen. Then I went back again. I said, hey doctor, I'm still having those pains outside of my menstrual cycle. So he gave me 10 naproxens. So I was like, oh, you're so supportive. So at the end of that was beginning of December. The end of December, I had my pap smear, and that's when I talked to my the registered nurse. It's the first time ever somebody said, hey Denise, how is your menstrual cycle? And I'm like, let me tell you about my menstrual cycle. I am dying over here. She's like, what? I said, yeah, I shared it with my family doctor. You can see the notes. She said, first of all, chest pains is not your menstrual cycle. And I was like, well, I don't know. Then she's like, shortness of breath is not just your menstrual cycle. So we need to take an x-ray of your lungs. And I'm like, yeah, that sounds good. That's a good idea. So we did all of that. But I just was like, why do I have to fight so hard? So I just was thinking, okay, we know the historical views on endometriosis is a white woman's disease. So I'm Black, I'm a Black woman, and I also thought, because I'm coming from work and I'm dressed and I'm going to see my doctor, it's just you don't look that ill. You don't look that ill. You seem strong and focused and determined. And it's yeah, as a Black woman, I have that armor on every day. I have to present that way to the world, that I'm focused, I'm strong, I'm able. So when I come to the doctor's office, I can't take off that armor. That armor is always with me. So maybe I wasn't vulnerable. Maybe I wasn't sad. Maybe I didn't cry in front of my doctor, but I was explaining it exactly what was happening to me. And I shouldn't have to go several times and then talk to a nurse to be acknowledged of my health issues. People with endometriosis, it takes them 3 different doctors to get an opinion about their pain that they're going through before they're even encouraged to even see a gynecologist. I remember I asked my doctor, maybe I should see a gynecologist since it's, this area and you're not helping. And he said, well, Black women have fibroids. So I said, oh, yeah, okay. And they have cysts. So it's probably just fibroids and cysts that you're going through. But it doesn't sound that it's too bad. So I said, okay, I think it is. So can I have a referral to see a gynecologist? And he was so mad. He was like, a gynecologist? Why would you see a gynecologist? I'm telling you the information. What difference? What can they tell you that I'm not telling you? So when he said that, I was like, all right, let me get my stuff and get out of this office, because you're not trying to help me at all. I'm like, why are you so defensive? I don't know, you just don't believe that I'm in pain. Why?
Yeah, why aren't women believed?
Why
it could be
just dismissed.
endometriosis, adenomyosis, whatever it is, they're not believed. It's very unfortunate. But Janet, the foundation is focusing on connecting women to healthcare that they need. Can you talk a bit about that?
Well, I think these stories are just so similar
Yeah.
across the women's health and our lifespan that we have to start taking these things more seriously. Our own research shows that women have very high trust in their healthcare providers, but they're not getting that support. It does take several visits before they actually find somebody that might help them. So we really encourage women, they have to be their own best health advocates at this stage of life. You have to really understand the changes that are happening to your body. We cannot blame our healthcare system, however. The reality is when it comes to menopause, very few healthcare providers receive education and training. That means we are failing half of the population who will go through this stage of life. So it's so important that women advocate for themselves. You understand the changes that are happening with you. We encourage you to visit our website, menopausefoundationcanada.ca. We've got resources to help you prepare to have a high-quality conversation with your healthcare provider, resources to support you to find another healthcare provider. One thing, this systemic inequality when it comes to women's health at this stage of life is very real. We think that, of course, a gynecologist will know about this. That's not the case. Very few gynecologists also have the training and the education to support us. So advocacy for yourself, for the broader cause is necessary. And we just encourage women, do not give up. Do not buy into the societal acceptance of this high tolerance for female suffering. You must advocate for yourself. Do not accept having mediocre health or having a lesser quality of life, because we really want women to thrive at this stage of life because it's so exciting, this stage of life. And when you feel good, you can take on the world. So that's what we're looking to do.
That is fabulous. We have some time for audience questions. So I would like to, does anybody have a question in the audience? Right here. We just need to wait for someone to bring you a microphone so everyone can hear the question. Go ahead.
Hi. Can you hear me?
Yes, introduce yourself and tell us your question.
My name is Rosie Bustamante, and I am an advisor at Sun Life. And I've been in my menopause journey for the last 10 years, so oh boy, do I identify myself with everything you're saying. But I'm curious to know, on Rita, how long did the system, how long did it take you to diagnose your endometriosis?
Well, I was 35 when I got diagnosed.
And how many
So
years,
that's
how long
most
did it take?
people, it's 5 to 6 years or 20 years
Wow.
that you're in pain and going through several medications, several doctors, missing school, not being able to even get into the workforce because the symptoms start at 14, right? 14, 15. And 20 years.
So you were 5 years before they...
Well, when I actually, see, it's hard for me because you mentioned like the high tolerance. That's what we're told as Black people. You have a high tolerance level of pain, so you can take it. So for me, it's just like a bad period is the part of my life. So why I didn't even think to talk to my doctor about my menstrual cycle being like so horrible until I was in debilitating pain. So at 35 is when I was passed out,
Wow.
couldn't breathe, and I didn't even think it was endometriosis, to be honest, right? I didn't even know what endometriosis was. Lack of knowledge, lack of education, never heard of this word until I was diagnosed. So that's why now the Endo Network Canada, we want you to know endo. So that's our campaign. And we want to start from like adolescence. Because 35 is, I'm almost lucky that I kept pushing and pushing and pushing through, because most people can't go into their career at 35. They probably can't even maintain work in their 14, 15, 16, right? So it's difficult. Nobody should have to wait or suffer for 5 to 6 years or 20 years. It's horrible.
Anybody else have any questions in the audience? Oh, okay, there's a...
Yeah, thank you so much for sharing your journeys. I mean, endometriosis, fertility, and menopausal symptoms are almost not endometriosis, maybe not universal, but there's certainly issues that I'm really glad are being chatted about more and talked about more. What advice would you give to people who are trying to get an issue on their company's radar, and if they're getting pushback about the issue being important, especially if it affects specifically women?
Go ahead.
I can take this one. That's such a lovely question. I say it starts with vulnerability. So being vulnerable to share your story with one person at the company or with the whole company, depending where you work. I think that's the starting point, because people can't help out what they don't know about. So I think really that's where it starts, having vulnerability. Anytime
But you have to have a safe place, right?
Oh,
You're not
safe,
gonna-
yeah.
I'm not going to be vulnerable if you're going to tell me and fan me off. That's going to be hard, right? I'm going to have my armor on still.
For sure.
Offer a safe place, for me to talk about my health issues. Yeah. And I could be vulnerable.
Yeah.
I think this woman in the front had, yes, with the pink glasses, had a question, or, okay.
Hi, I'm Tina Starker-Thompson from the ROM. Question, I guess, for all of you. Are there resources that you could point us, HR folks, to in terms of how we can help our managers, how we can help coach and train our managers to have those conversations? Because I think it's like you said, people don't know what they don't know, and people want to help, but there's also that fear from managers, like, oh, I can't ask that. What do I say? What do I not say? Okay, go to HR, right? And so that would be very helpful, I think, for some of us.
Yeah, I might offer that, the organization's role is not to solve an individual's health problems. The organization is there to create a high trust environment with employees so that the employee feels confident and comfortable raising any issue that they may be experiencing, which is a barrier to their full performance and potential within the organization. So all of these issues, yes, you need to be vulnerable. Yes, you need that safe space. But the organization's responsibility is to create that high trust environment where they care and they're committed to ensuring that they're looking at whatever barrier the employee may be experiencing. And that might be menopause, it might be endometriosis, it might be fertility. So in terms of resources, our Menopause Works Here campaign includes this Menopause Inclusive Workplace Playbook that has free downloadable resources that you can use so that and it has some tips and tools for managers. But I think we need to approach this as supporting employees through different stages of life. This is not about doing something special. This is not about special treatment. This is about recognizing that we have ignored women's health and these particular situations, and that is not healthy for the organization. That will not allow us to attract and retain top talent. And I can tell you, that's what organizations care about. They need to keep top employees working effectively, and the more we can do that in the right way, the more organizations will just step up and go, well, of course, we didn't realize that this was such a significant issue. And if we can share with them some pretty simple things that they can do to normalize conversation, to look at their policies, to look at their benefits, it can go a very long way to creating an inclusive environment that is very supportive of keeping your talent in place and performing at their best. Great question.
No, I just wanted to mention, it is a great question. One thing that I had previously from an employer before coming into the space that I am at now, we had supervision and touch base every month. and it's an agenda that you can add. If we want to talk about work, we have our caseload we want to talk about, our numbers, our stats. I know we have to meet those, but also time for me and you as a manager to discuss what's happening to me, because I can't not change that I have endometriosis. If I could say 9 to 5, endo, I leave it at home and I'll pick it up later, that would be great. Well, I wouldn't even pick it back up, but I can't. And it varies, right? Today, like today, I'm okay. Tomorrow, I might not be able to get out of bed, right? I might have to choose between, going to go groceries or taking a shower. I don't know, right? It changes every day for me, sometimes every minute. So it would be great if my manager said, you know what, every month we're going to have time where we could just talk about you. You bring to the table and let me know what's happening for you. And that way, if you want to share, your story about endo, is there information, downloadable information, which we have. Our ambassadors created a ton of resources that's accessible, that any employer or any person could read and get the information that they can, that way they can help somebody or guide them or support them, who's going through endometriosis. Because there's no cure, just to let you know. So I'll have this for the rest of my life,
Shauna, what about you? What is your number one tip for people managers or HR specialists who are in our audience?
Well, I do want to shout out Fertility Friends Foundation, having tons of resources that you can go to and check them out to get educated. And then just throwing another stat out there, 1 in 6 individuals are affected by infertility. That's a stat published by the WHO. And so it is out there, it's in your workplace, whether or not people are talking about it, and that it's also really affecting men because, they're part of the equation when it comes to infertility. So I also wanted to mention that.
So we have just under 3 minutes left, time for one last audience question.
This one in the corner.
I think there's one over there.
Everyone's pointing at each other. Everyone's so polite. Who wants to go?
There's one over there.
One at the back.
Behind the podium? I'm sorry, I can't see you. Oh, go ahead. Great. Somebody give her a mic.
First of all, this is the day I needed today, so thank you. This is the day we all needed today, so thank you. My name is Marjorie, and I'm the founder and CEO of a woman-led company where we have over 60% of our staff of 9 are female. And I prided ourselves on our professional development. We have had mental health first aid training, we've had Indigenous relations training, we've had LGBTQ pronoun training, and I am sad to just really realize that we have never had anything like this. So if there's anyone in the room that would like to talk to me afterwards, I'll be the one with a glass of wine later, about some kind of professional development, because this is profound. The penny dropped. Of course, I'm going through perimenopause like you, Rita. Let's please talk about it. Also, I hadn't realized that supporting people at all stages, and if we break the taboos by having men in the room when we're talking about women's issues in a safe place, then I can stop worrying so much about my daughter. So please, let's keep this conversation going. What a beautiful penny, and thank you all for your stories. I so appreciate them. I am them, and what a wonderful room to be a part of today. Yeah. Thank you so much.
Thank you also for your, very honest commentary about your own situation and gaining awareness and the importance of being open to gaining awareness.
We can come to your organization, the Endo Network Canada. We got tons of resources. We have people that could present and do training. We're ready.
See, this is very solutions-based discussion. Unfortunately, though, we're going to have to leave the conversation there because we are out of time. This was great. This was a fabulous discussion. Thank you all for your honesty, your forthrightness, and for your, commitment to creating education and for breaking taboos. It's so important. It's so refreshing. Next up, we have a networking event and a refreshment break. So please be back at 2:20 for the second half of our program. But thank you again to our amazing speakers, Denise, Shauna, and Janet.
Thank you. Thank you for having us.
All right, I'm going to give everyone a second to settle down, but I'll start my spiel. My name's Sandra Martin, and I am the standards editor at the Globe and Mail. I'm so excited to be moderating this next panel. I'm going to just jump right in and introduce our speakers. We are very lucky to have two incredible women talking about women's mental health at work. And of course, mental health is important for everyone, no matter your gender. But we know that the pressures on mental health can look quite different for women compared to men. And we wanted to spend the next half hour focusing on women's mental health at work. So our first speaker is Rachel Mansell, Director of Policy and Research with the Prosperity Project. So excited to have her with us. Rachel's organization aims to create a world where all women can thrive. So I'd love to welcome Rachel to the stage and also thank her for jumping in. Rachel very kindly jumped in last minute. Julie Savard-Shaw, who was scheduled to speak, couldn't be here today due to unforeseen circumstances, so we're very lucky to have Rachel with us. And Sonia Kang will be joining us virtually. Sonia is the Canada Research Chair in Identity, Diversity, and Inclusion with the Institute for Gender and the Economy at the University of Toronto, so we'll be able to see Sonia on the screen. So thanks for joining us, Sonia. There she is.
Hey, everyone.
All right, thank you so much for being with us. I can't overstate how excited I am. So let's jump right into it. Rachel, I'm going to start with you. When we spoke earlier to prepare for this interview, you wanted to get across the point that women are experiencing burnout and pressures on their mental health at a much higher rate. And if you're feeling it out there, I think we all are to agree. We're certainly not alone. I was really shocked by the data. A report that your organization put out that noted 77% of women say they have considered quitting their jobs over work-related issues, and that compares to 66% of men. So let's talk about that for a while, maybe starting with why do women feel this stress so much more acutely?
Absolutely, and I'm actually going to answer that by leading with another statistic that we found, which is 60% of women feel like they have to choose between family and work. So I think, when we take these two things together, that explains a little bit why there's a higher percentage of women that feel like they need to exit the workforce. And even when I say the words choose between family and work, most people probably think kids. But the reality is, for so many of us, family now encompasses aging parents, extended family. That can mean so many different things, and the reality still is that the majority of that burden falls on women.
And what is it that they're not getting in their workplaces that sort of leads them to jump to that conclusion, okay, I have to make a choice?
I think some of the things that we heard in some of the earlier conversations today, things like flexibility, things like workplace balance, things like a job that someone actually likes doing instead of just being given all the leftover tasks or being expected to take on the additional tasks of managing a workplace.
Yeah, Sonia, I'm going to invite you to jump in because you had talked earlier about how broader policies can be helpful. So, for example, encouraging men to take parental leave, not just offering that as a potential benefit. So can you speak to that?
Yeah, absolutely. So thanks for inviting me again. So there's always been a gap in terms of parental leave usage between mothers and fathers. The most latest statistic that we have is still showing a really huge gender gap. For people with kids under 1 year old, the percentage of mothers who take or who are currently on leave is around 75%. and the percentage of men with kids the same age who are on a leave is 7%. And that's like a huge enduring gender gap. We haven't really seen a change in that over time. And I think there's a few different things that are going on that are kind of contributing to that. One of them is just kind of societal ideas around fatherhood, what that looks like. It's much more situated in terms of like being at work, right? And making money and providing for the family, not doing the direct caregiving. And then as well, there's also, you know, these conceptions around masculinity and what that means in terms of what you do at work, right? You're there and you're actually doing your work. So in terms of structures, some of the things that can be done is making it easier and more normative for fathers to be taking those leaves. So an example of that is our kind of use it or lose it parental leave policy that came into place in 2015, I think, in Canada. And really ensuring that people who are kind of across all levels of the organization are taking those leaves, men and women, and kind of role modeling that. And then when you show that this is something that's kind of expected, right? There's not that pressure on men to stay in the workplace and kind of show that they're there and they're working and they're like, you know, demonstrating their masculinity. Hand in hand with that, I think, is as more men start taking those leaves, their kind of efficacy, right? Fatherhood self-efficacy also increases. And so then they're more inclined to take more time off or, you know, take care of their kids as they're older as well. So putting in that early time, I think, increases their self-efficacy such that, like, as their kids get older, the default parenting role doesn't just fall on the mom.
Yeah, I mean, staying on that topic for a bit, and this is just something that anecdotally, because I've worked in a lot of different workplaces, I seem to have noticed as a common thread. There can be great policies, but unless the people at the top, the senior executives are modeling, as you pointed out with parental leave for men, unless the people at the top are modeling, I'm taking a sick day, I can't make this meeting because there's something that's very important for my family, or I have to take care of an aging parent. How important is it for those kinds of policies to be modeled at the very top?
I can start with that. Very important. And I think one of the reasons for that is the reality is, even though we have come so far, you know, a few weeks ago we were celebrating Persons Day when women became recognized as persons, but at the same time we know that not all women were recognized at the same level on that day. And the reason I mention that is because the workplace is still modeled on the concept of the ideal worker being a man who does not have any other responsibilities. And that's still the concept of what an ideal worker looks like. It's an exception to take your sick day. It's an exception to take your personal day. It's an exception to have to adjust your workplace flexibility so that you can pick up your kids from school or take your aging parent to an appointment. So when that is modeled from the top, it becomes less of an exception and more part of your organizational culture. And that's what we're ultimately striving for, as was spoken about earlier. This needs to be normalized, not the exception to the rule.
Yeah, thanks. Sonia, anything you wanted to add to that?
No, I totally agree. I think Julie has this idea like really well articulated about the kind of making this the norm, not allowing it to be an exception, but just like, this is what we expect from everyone. Like, you don't have to explain this, right? So this is available, you take it. And then that way it kind of takes the pressure off of individuals to navigate, well, you know, what is this going to mean for my career? Is this going to mean I'm not going to get promoted later on? It just makes it kind of the default. We all do it. And so we're not being penalized based on whether or not we're taking this leave. And I think one of the big drivers of just like the gender wage gap in general is this decision where women are taking this time out from their careers. This kind of, you know, widens the gender gap over those years. And then men aren't taking that time, right? So they're still investing in their careers. And if this is something that everyone is doing across the board, then that should also help to kind of like bring that into the middle a little bit more.
Something that's related that you brought up is the phenomenon of identity threat. Can you explain what that is and talk about how it relates to mental health and even just opportunity at work?
Yeah, so identity threat, it's one of the main areas of my own research. So basically identity threat just means that anytime you're in a situation where you feel like some aspect of your identity, this could be, gender, race, the intersection of those things, when you feel like those identities are being devalued or challenged at work. And what happens when we experience an identity threat? So let's say you're at a meeting and no one really picks up on your idea, and then a man presents it after you and they're like, this is great. Experiencing that identity threat leads to a lot of stress in the moment. So we have this fight or flight response. And we also have an emotional stress response, which is, these negative thoughts, these negative feelings, do I really belong here? This is a lot of where imposter syndrome comes from. And the really kind of long-term consequences of identity threat are that we have to really pay a lot of attention to that physiological stress response or emotional stress response to appear like we're not bothered, right? So there's a lot of pretending that goes on with women where we just pretend everything's cool on the surface. That requires a lot of energy. We have to suppress a lot of negative thoughts, feelings, kind of our bodily responses as well. And doing that over a long period of time leads to depletion of cognitive resources. So you actually, aren't able to do your job as well, which then again leads back into identity threat because it kind of confirms the imposter syndrome that you're experiencing. Maybe I'm not good enough. And so the reason why identity threat is so damaging is because only certain people, everyone experiences identity threat from time to time in their lives, but certain people from traditionally disadvantaged groups are experiencing that kind of identity threat, every day, sometimes multiple times a day. And that can lead to a lot of the burnout and fatigue that we see among women and members of other traditionally disadvantaged groups in the workplace, where they'll actually end up leaving, right? And so this is people always talk about the pipeline, people are just dropping out for fun, but it's actually this. It's they're getting pushed out of the pipeline because of these threats to their identity, and no one can maintain that kind of chronic stress over long periods of time.
So it might feel like the only option is to go elsewhere, to feel like you're being seen and appreciated. Rachel, I want to go back to you because you've talked about this effect regarding women who are newcomers or immigrants to Canada, and the pressure can be even higher for these women. Talk about the reasons for that.
Absolutely. There is a burden that comes with being the trailblazer. And I think very similar to what Sonia was just saying, it is that added pressure and sense of threat. The idea that if you even mess up the smallest bit, you are letting down everyone else. A few years ago, I was in a human rights role at a university. And I'm the kind of person where any type of person that has a similar skin tone as me, they just assume I'm from wherever they're from. I just have a very pan-South Asian set of features. And the reality is, though, I'm Indo-Caribbean, I'm half Trini, half Guyanese. And one of my junior reports found this out. She came up to me a few months later and she said, I'm so inspired by you. I've never met someone from our community doing this kind of work. I didn't know how to tell my family that this is what I wanted to do. And while on the one hand, of course, I was extremely flattered, it was like a punch to the gut because I thought, she's looking up to me, I have to model for her, I have to be an example for her. I'm the only one in our entire community that she knows that is doing what she wants to do. And as a result, when I had to leave that role for personal reasons, we were moving elsewhere, I really struggled with the decision. I wouldn't have struggled otherwise. And that back and forth, that burden of being the trailblazer, if you have moved to this country for better opportunities, if your parents did that and you know that's part of your story, it's in your DNA, that is endemic to how you make every single decision. And that absolutely affects your mental health at work.
Wow. I wanted to talk about ageism, if I may, because that's something as a woman of a certain age, I'm hearing from my peer group, where they feel, either they are too expensive for a job that they think, I think I want to just take a bit of a rest. I'm going to apply for this job that is maybe not as senior as my previous role. Oh, no, I can't possibly hire you. Or they're looked through as perhaps not someone we can develop. for a more senior role. So is that something, I mean, aside from anecdotally, that you've both noticed in your work? Sonia, I'll put you on the spot first.
Yeah, sure. So this is definitely real. So, we call this the gender age wage gap. And basically the idea is that over time, the gender wage gap actually gets worse. So I think, typically the worst periods of time are during those, what we would, refer to as the child rearing years. We actually see the worst gender pay gap for between women and men around 35 to 44 years old. It actually drops down to 68 cents. Women make 68 cents on the dollar on every dollar that men make. It starts out, closer to 79, 80 cents. And then at this low point, it's actually below 70 cents. And a lot of this is related to actually physically being out of the workplace. But there's also a huge component in terms of age-related stereotypes, which also increase, right, as we get older. So, there's very different stereotypes that relate to aging for men versus women. For men, they get this like wise stereotype, right? They have all this experience. People look to them for advice. Women, that stereotype is very different, right? It's often associated with ideas of frailty, cognitive decline. And so those stereotypes, even though the aging process is actually very similar, if not like, it's close enough that they're not, statistically significantly different from each other, those stereotypes do exist. And so that combination of physically being out of the workplace and these stereotypes that affect the aging related stereotypes that affect men and women differently really do exacerbate that age gap over time. And then just kind of going back to Rachel's story, I think I called you Julie before because I have Julie in my mind. Just going back to your story, right? Like the race and the immigration status, like all of those other stereotypes also compound this effect. So there is going to be even a larger effect for, let's say, women of color, women who are newcomers to Canada, because all of these different stereotypes are kind of interweaving and interplaying with each other. So yes, the gender pay gap definitely does increase over time. And there's structural factors like, getting women out of the workplace for, parental leave, which we could hopefully help to close by getting more men to take parental leave, but then also these stereotypes that we really need to contend with, I think, at a societal level, and really think about, no, there aren't different experiences necessarily of like what aging looks like for men, what aging looks like for women. One thing that we also talked about was, there's a lot more awareness around menopause right now in the workplace and how that affects women's kind of ascension into leadership roles. And I think, some of the things that we've been talking about already with, having like flex days or having periods of time they are allowed to kind of work remotely, I think that could also really help. So it's a combination, I think, of these structural kind of solutions as well as individual type interventions to really challenge those stereotypes about what happens with aging.
And then again, making it okay to actually use those days or hours or time away. I ran into a colleague who's a bit younger than me on the way in, and she said that she has had a torn Achilles tendon for, I think, several years. And she's just like working through it. I mean, that's what so often we hear women doing. So, not to be TMI, but, the symptoms of menopause, like, I was just like, oh, why am I like so low energy? I don't understand. Then I went to my doctor. She's like, yeah, I think that might be what? So like, I'm really hoping that this dialogue allows women to share with each other and say, okay, that could be not just that you're tired. I think maybe you want to consider that it's a symptom of menopause. So going from that to the youngest workers, and of course we don't want to generalize too much, but there are some stats that show there are differences based on age and generation. So a report from the HR management company UKG showed that 83% of Gen Z workers say they feel burned out. The youngest workers are already feeling burned out, so that's remarkable. And Gen Z are entering the workforce now. My older daughter just graduated and is in the workforce now. What do employers need to do to be prepared for this? How can we support these workers? So let's start with you.
Absolutely. So I think We're at a really interesting time in workplaces where, particularly in large organizations, you might have 4 different generations working together, all bringing their own generational perspectives to whatever deliverable you're trying to pursue. And naturally, every generation has different views than the one before it. We've faced different challenges. What I'm navigating now is different than what my mother navigated, what my grandmother navigated, but it is also different than what the Gen Z person is navigating. So what employers need to understand is, 1, there are different perspectives. That can be harnessed. We know diversity of thought is beneficial. However, they are also the youngest generation. There are lessons that they are learning from us, the good and the bad. So I think employers really need to take into consideration some of the things that we were speaking about. Is there that high trust environment where someone can ask questions? Is there an environment where someone can actually be trained? And by trained, I don't mean dropped into the deep end and figure it out on your own. You get to do that when you're senior. You don't know how to do that yet when you're just entering the workforce. So employers need to understand that this generation of new workers is coming out of the pandemic when they're used to working remotely. They're not necessarily coming equipped with some of the same people skills and soft skills that a lot of us either learned through in-person interactions during our undergraduate or graduate training, or through our mentors in the workplaces and our champions. They might not even know yet how to ask for it. What they do know is that they don't feel supported, that they don't know what they don't know, and they know that they don't know it yet, but they also have a much better vocabulary to be able to articulate that. My Gen Z people that I manage and supervise can come to me and talk about their mental health and their burnout and what they're going through with a vocabulary that I'm still learning.
Again, laughs of recognition. Sonia, do you want to add anything to that?
I think I agree with all of that, especially the piece around the vocabulary. So, with my students, they're very good at communicating exactly what's going on with them in a way that people, I'm a millennial, millennials don't do that. So that's really interesting because as Rachel said, you have these different generations that have different ways of communicating. And I think one of the really good aspects of having that increased vocabulary is that other generations then have the opportunity to understand and learn about that in a way that we didn't when we were kind of coming up. For example, I remember when I was in grad school, if I had a lot of work, I would just do it and do it until it was done, work over the weekend, whatever it took, even if I was super tired. My PhD students now don't do that. And it was shocking to me at first. I was oh my God, they're not working on the weekend. How are they going to get through? And through watching them and seeing no, this actually helps them, work more efficiently and more effectively when they're actually working, taking this time off. I think that really taught me a lot. And I was able to start doing that without feeling guilty about it. So I think that's a nice kind of framing, is to think about what older generations also have to learn from, how Gen Z is kind of handling this pressure that we've always had, but just didn't really understand how to communicate about, or, what to even do about it, how to recognize it in ourselves.
I want to add something to that if I can. I think part of potentially a reason why that stat might be so high is the ability to identify burnout. As Sonia was just suggesting, that's a word that came into my vocabulary very recently because that's just not the way that a lot of us were trained. And so I don't know that that stat necessarily indicates that they're experiencing it more than those who might be older than them are, but they know how to identify it.
All right, well, thank you for this. We've got a couple of minutes, so we can take 1 or 2 questions from the audience. If anyone in the room has a question, we've got microphones and can bring that over to you. Oh, we have a question right here at the front. Thanks so much.
Hi, Victoria. I was wondering if you could talk about maybe how unconscious biases might be coming out in the workplace in the way that women are being treated and might be leading more towards burnout, especially, I'm thinking boomer managers.
That is a great question.
Absolutely. Sonia, did you Want to start with that one?
Oh, sure. So I think, going back to what I was talking about with the identity threat, I think a lot of the experiences of identity threat that people have are rooted in unconscious bias. So, in today's workplace, it's not as common, like it certainly happens where people are explicitly sexist. It's much more likely that people are kind of, it's like you've heard probably about microaggression. So it's like that level where it's these like subtle kind of ambiguous statements that people make or assumptions that people make, which are in some ways even more challenging to handle. Because if someone's like outright sexist to you, then at least you can be like, wow, okay, like this person was sexist, this is about them. But if they do something that is kind of more subtle, rooted in unconscious bias, like for example, they don't offer you a particular assignment because they think like you're not gonna be able to take it on because you need to spend more time with your family. That type of thing is almost more damaging because it's so insidious. Like you see it all across different kinds of decisions that are being made about your career, like offering you training, let's say, offering you mentorship, like, informal social interactions. And so I think with understanding unconscious bias, like this is another like awareness kind of vocabulary type benefit. Like now I think people understand unconscious bias a lot more. And so when we experience those types of microaggressions, hopefully we recognize them as such, right? Because I think previous generations, and I used to do this too when I was younger, like if I experienced something like that, I would always kind of attribute it to like a shortcoming in myself, right? And this is like where imposter thoughts come from. Whereas now, like Rachel said, only very recently have I become good at like recognizing bias in others and attributing that kind of negative experience to them. And I think that is a really good skill to kind of practice and learn, is understanding that unconscious bias does exist and is underlying a lot of these sort of, low level, subtle, ambiguous types of biases that we experience. And just like a quick note before we go on, I want to say that people talk about microaggressions a lot. And I just want to say that they're micro because of the subtle nature, or they're kind of, like below the surface, but they're not micro in terms of their effect. So over time, experiencing this kind of chronic stressor of unconscious bias is going to lead to burnout. It's going to result in fatigue and, leaving just as much as if you're experiencing explicit bias in the workplace too.
I'm so sorry that we're going to have to leave it there.
Gosh,
but I want to
sorry.
thank both of you, Sonia, Rachel, for being with us. We could have talked for another half hour.
Yeah.
Really appreciate you
Thank
spending
you.
the time. Thank you.
Thank you.
And now I'm going to hand it over to my colleague, Dave McGinn, who is going to take you into the next session.
Ooh. Hello, can you hear me? Hi, everyone. Thank you, Sandra. My name is Dave McGinn. I am a reporter for the Globe and Mail. I cover parenting and family life. I have been telling friends that I was invited to host a panel today, and they've said, oh, what's it on? And I said, it's about women's health at work. And all of them said, huh. But that is a theme we will get to. For now, let me tell you that we have had some wonderful conversations about women's health at work today, and we wanted to put together a panel of corporate leaders who can talk about solutions and strategies. We have a wonderful group for you. Please help me welcome them. First off, we have Helena Pagano, Executive Vice President, Chief People Officer, and Culture Officer with Sun Life. Next, we have Emin Alvi, Vice President of Global Pension and Benefits with Scotiabank. And last but not least, we have Stephanie Braid, Director of Inclusion, Diversity, and Equity with KPMG Canada. Hello, everyone. Thank you.
Hello.
I wanted to start with just a sort of general framing of kind of where we're at now with women's health at work, what the status quo of it has been, and where each of you sort of see it making progress or changes. Helena, let's start with you. Where have you seen this in the past, and where are you seeing it now?
Yeah, I think, and emblematic by the fact that we're having this session today, is that we've come a long way of seeing women's health as a business case. And with real value, there's an unmet need, there's opportunity, and there's a win-win in addressing that. I turn the very kind shout out from Janet Coe right back to her to say, you know, coming to a workplace to say, here is a fully packaged business case. Here's the problem, here's the outcome, here's the solutions. How could you not say yes to that? But it really helps to start the momentum of that. So I would say we've come a long way in seeing it as a business issue, and so now there's opportunity to talk about it. We've come a long way in finding champions who are willing to talk about it, champion in the organization, take on the difficult conversations, and companies like ours who are willing to say there needs to be benefit changes, program changes, policy changes to get through some of the barriers that people were facing previously.
Mm-hmm. And Stephanie, in our conversation prior to this, you had mentioned this is something that's very top of mind at KPMG. How are you seeing this as an issue out in the world now?
Yeah, I mean, I think some of what we've seen is, you know, definitely progress. I will say, I woke up today trying to really feel optimistic. And, you know, I do think, you know, in my career, we've seen quite a few changes. I've been in the workforce for about 15 years now. So I started when I was 23 years old, and I think about the level of comfort that I've seen occur, the shift with managers, with leaders in terms of, you know, speaking about mental health at work, speaking about women's health at work, parental leave, bias, gender bias, racism. We've really seen a shift. And we've seen a lot of implementation of new programs, policies as well. It really makes a difference. Like myself, since I've been in the workforce, 23, you know, starting with everything from breakups to I probably had 8 moves, including a move out of town, buying a home, marriage, having a child in the pandemic, mental health issues. And during that time, you know, we've had different supports that have been able to kind of meet me, be it, you know, things like inclusive parental leave top-up, things like very rich mental health benefit, which has been really, really amazing, flex work policies, remote work policies, you know, having access to personal care time. So all this has made a really big difference. All that being said, obviously still more work to do. I think our, you know, panel before did a good job showcasing some of that also. But like I said, I'm trying to be optimistic today, and yeah, I think we've seen a lot of positive change, and you know, more work to do to make sure that we have a workplace that works for all women.
Mm-hmm. Having a child during the pandemic is a whole other panel we can have some other time.
Ooh, that it is. That it is.
And then what about you?
I think what Helena and Stephanie said covers pretty much all of it, but I think it would be remiss not to recognize that there's been a lot of progress because there's been a lot of room for progress, and there continues to be a lot of that. I think we're still playing catch up in this space, and I think it's great that we have some momentum. We're having events like this, we're talking about it, and I think giving folks the space to voice what's missing and how that can be addressed, I think that's really critical.
Yeah. And I'm really interested, and I'm sure the whole room is too, about very specifics in terms of, you know, policies out there, practices out there. I was hoping each of you could give some examples of sort of specifics where you're seeing this being put into action. Helena, I'd like to start with you, if that's okay.
Yeah, I think so. It's like a whole gamut of things. You have to think about what do people need in terms of flexibility. And so we at Sun Life have taken a view on workplace flexibility. We've chosen to not implement mandates from the view of, and there was a great example, I think it was Denise saying, like, if you're having a health issue, you can't say, oh, sorry, put that on hold while I'm in my mandated days. There are lots of reasons we want people in the office. There's work that's done more effectively, but just putting that flexibility. So if I'm having kind of an off day, health issue, I need to go do something, that we have some flexibility around that. We have looked at across the board where are some underserved areas. So support for menopause, support for fertility, infertility, support for mental health, and then you make sure you go through and put those policies in place, which we have done. And then you look at those policies and say, where might some groups be still facing systemic barriers that others are not experiencing. So if you have a fertility issue as a same-gender couple, you face some different barriers. If you want to go through fertility as a single by choice person, you face other systemic barriers. You also have to keep digging away and saying, now I have to uncover the gap, and then I have to find all the systemic or unintentional barriers that other people face and go through and do them. So it's you need to be flexible for people, you need to provide support. We heard all the stories. You have to train managers on how to have good conversations so these conversations can surface. And then you need to make sure you have the workplace support, all wrapped up in an envelope of executive leadership and tone from the top. Sounds simple, like 5 big things all have to happen.
And Emin, how do you see this being put into practice at Scotiabank?
I think something we've really focused on are those systemic barriers that Helena brought up. We all know, and we've talked about today, that there's been historically disadvantaged group as women in terms of healthcare outcomes and support that they receive. So we've taken an approach where we've really done a lot of research on how we can improve health outcomes for women specifically and understanding their specific issues. We have the fortune and challenge of working in many different countries. So part of the lens that we look at that is, what does it feel like to be a Scotiabanker no matter where you are, whether you're in Toronto, whether you're in Singapore, you're in Chile, it doesn't matter. We want that experience to feel the same. And really looking at it from that lens of how can we bring people to a similar standard. That doesn't mean it's going to be the same everywhere, but really looking at how we can be more inclusive in a systematic way. So we've been working for the last couple of years on what we call our Global Inclusive Standards of Care, and that really looks specifically, it's a very dense document that looks at different areas of health where we can provide better support across the board. And it's pretty remarkable the things you find when you start looking under the hood for some of these things. I'll give one example. In Asia, very common for health insurance policies. If you have breast cancer, there's coverage for treatment. If you have recurrence, there's no coverage for treatment, specifically for breast cancer. That doesn't sound right. So that's a simpler example, but there's a lot of things like this that you find when you start digging into it, and that's something that we're trying to systematically over time across our footprint address and improve those health outcomes. It helps our workforce, it helps communities and society as a whole to push that forward.
And Stephanie, what about KPMG and the work you're doing there?
Yeah, so we definitely have implemented some really incredible benefits and programs that I'm really personally proud of, including our Indigenous wellness benefit, gender affirmation benefit. I mentioned our inclusive parental leave policies. The list goes on, but maybe I want to pick up on something that Helena said around manager training. And I think obviously having really good programs, policies, benefits, supports in place is super important. It really gives people the opportunity to have access to supports that they need. But then, something else that also really impacts their day-to-day experience is the culture that they're working in, the day-to-day actions of their team and their manager. And so one thing that, me and my team and some of the work that we've been doing around inclusive leadership has really been to kind of address, that day-to-day experience that can really have such an impact on women's mental health, well-being at work. And so we've really been tackling that in many ways, looking at, for example, when people are being promoted to a leadership position, a senior manager partnership role, embedding inclusive leadership training in those moments. How do they support the mental health and well-being of themselves and their teams, that they have this new role that they're taking on. How do they make sure that they are engaging everyone, making sure everyone feels seen, everyone feels valued, everyone feels heard, making sure that when people have a different identity than they do, that they are able to still interact, respect them, show up well, make sure that those people are valued, that they see they have career opportunities. And at the same time, making sure we all work in teams, so it can't just be about leaders. We have to upskill everybody. And so we've really made sure that, in particular through some of our employee resource groups, we have monthly education sessions that are offered to everyone in the firm, every level, to advance their awareness on disability inclusion, truth and reconciliation, so everyone can take part. One more thing I just wanted to mention that we're also doing to advance inclusive leadership capabilities is really investing in mentorship and making sure that we have mentorship programs in place for some of our underrepresented groups at the firm. For example, we have mentoring programs for Indigenous people, people with disabilities. We have mentorship programs for newcomers to Canada, new immigrants, not just for women, but we certainly have very, very high representation of women in those programs as well, and making sure that they are getting that democratic access to career support, to development, to advice that can be really, really impactful. And on the flip side, it really also helps all the mentors, often who don't maybe hold the same identities as people in these programs, become better leaders, become more inclusive, and that they can show up in their day-to-day interactions with those individuals and their teams and in their personal lives, as more inclusive. So it's really made a big difference. We've seen lots of lifts in some of our inclusion and equity scores and just the experience of our people and those leaders as well.
Yeah, I'm so glad you brought this up because I think I'm here because I've written in the past a lot about how, issues of gender really need to be a group effort, right? We can't just leave women's health to women. That is a failure for all of us. You had mentioned some great things just there about, mentorship and managerial training. I'm curious to hear from the two of you about, how do we create a culture where this is everyone's issue at work, or at least an awareness of it at work and not something that's separate or sidelined?
Oh, foundational to that. I mean, we spend a lot of time thinking about our culture, our values. At Sun Life, we think of ourselves as a purpose-driven organization. Our purpose is healthier lives and lifetime financial security. How could this topic of women's health not be central to our purpose? It's so aligned. But what's really important about that is if it's not hard to dig into the data and see every once in a while you see some companies who have a particular position, a policy that has some goals associated with it. And you also see some companies pulling them back. And then every time I see companies doing that, I think that is not core to their culture or values, because if it was really your principles, you wouldn't pull it back. So that's where I have lots of confidence in an organization like ours, where it's so central to the purpose. That culture and purpose and values propels this behavior forward. I have tables full of colleagues who are thinking of now there's all kinds of more business opportunities to expand on this. I've just planted that seed for you, whether you do or not. You now have, now I have tables full of colleagues who are going to take this forward because it's so central to what we do. And so when you have that, then you get the behavioral alignment, you get the senior management buy-in, you're going to find support and resources, you're going to find commitment when the going gets tough, because there will always be pushback. And that's when you know that your values matter, is that you don't buckle when the going gets tough.
Yeah, I think tone from the top and how it feeds into your day-to-day is critical. For employees as well to feel that sense of belonging, that yes, this is an organization that cares about me. But I think there's so many hooks and angles. Like, it's hard to think of a reason not to support it. It makes sense. We're a bank. We have clients who are women. More than half of our employees are women. If you're not taking care of them, something's going to fail at a fundamental level. So I think having it as part of your core values is really important, and not just having it written there, but living it and doing it day by day. I think these mentorship programs, sponsorship programs, recognizing where those gaps are and actively and intentionally trying to fill them is really, really important. Not just saying it, but acting on it. And I think also just understanding what's out there, and when you don't know, acknowledging that and learning from it. I think that really makes a big difference, and again, helps you live out what's important. And I think that comes through in your work. It comes through when you deal with your clients, with your partners. It's something that'll be there on a day-to-day basis, and people understand that it's important.
And one very important theme that came up in the previous panel and was very much emphasized in our call prior to this was the idea that women are not a monolith, right? When we talk about women's health at work, we're talking about all different kinds of women, all different kinds of, ages, women with disability, women from the LGBTQS+ community, women of color. How important is it for organizations to keep that diversity in mind and really craft policies and practices that are influenced by that awareness. Stephanie, I'll start with you.
Well, it's very important to our conversation. Yeah, women are absolutely not a monolith. Like I look at our firm as an example, we're 54% women, but when you sort of dig a little bit deeper, more than half of those women are either women of color, women with disabilities, newer to Canada, to us LGBTQIA+. And so, and also when we look even deeper and we're talking about different generations, a third of our workforce is actually Gen Z. We have a very young workforce in a lot of ways, which is really interesting. And a third are parents. So, you know, women across different life cycles, different identities, different backgrounds, they do not have the same experiences. They do not need the same things. Oh, sorry, I thought I was getting some feedback for a second. And so, yeah, I think it's really important to recognize that women are not a monolith. That's where we absolutely have to start. And then I think, you know, from their organizations, you know, really listening to women, recognizing maybe the limitations of the design teams that you're putting together, right? For example, often we're working, you know, HR teams, a lot of white women, you know, we're working, sometimes business leaders are making decisions, might be a lot of white men, right? So really having to recognize your limitations, doing that outreach, you know, if you're lucky, maybe you'll be like us and you'll have employee resource groups that you can tap into to really understand their experiences, their perspective, what matters to them, what's important to them, what some of the barriers are that they're facing, and then you can design from there. So yeah, it's very, very important. And absolutely critical to, I think, just co-designing and creating any good programs, policies, and practices as an organization today.
Yeah, Emin, I would imagine this is something very much on the mind at Scotiabank.
Absolutely, and you know, the monolith piece is something that you have to remind yourself of all the time. I know I do it all the time because we look at a lot of data and information with our pension and benefit programs, and we're like, oh, this average and that average, and it's like, oh wait, there's no such thing as an actual average employee. Same thing, there's no typical woman, everyone is unique. So I think leveraging employee resource groups is really important to get that feedback and understand what people are going through. And I think also creating an environment where employees feel empowered and safe to speak their mind and share how they feel. That doesn't mean we're able to address every single issue that comes up, but at least we understand what's out there and what we're dealing with. I think that goes a really long way towards that. And also putting in the time yourself to understand where those intersectionalities exist, where those gaps are. So I mentioned our inclusive standards of care. The other major lens that we focused on is the 2S LGBTQIA+ community, because again, historically, systemic gaps, huge barriers to healthcare and health outcomes. So those are the two major lenses we've looked at. The other thing that's interesting with some of these things is, yes, there are specific supports that women need, but some supports that you're providing benefit everyone. We talked earlier about caregiving and burnout. Those are issues that affect everyone. I think they affect women more than men, generally speaking, in the workplace. But if you're supporting that in women, the men are also getting the support. It's not that, oh, this is just for this person and nobody else gets to benefit from it. So I think that's an angle that's sometimes forgotten, that there are benefits that happen more broadly, even though you're looking at it with a specific lens.
And I'll just add quickly, because a lot has been said that's really valuable and right on the mark. I think if you think about it from a business perspective, it's just starting with user-centered design. What is the needs of the user, and you design for that. So that's really the way to think about it. And I think we saw terrific data highlighted in the presentation from McKinsey that said, what was the gap that was created by thinking of health as a health of a person and not addressing women's health? Well, that is the extension of, and then these are all the other gaps and that are potentially there, not being addressed by considering the needs of the user.
And before we open it up to questions, because I'm sure there will be many, I just wanted to ask the last question, which is, you know, where you see this going? Where do you see progress being made? Where do you see progress needing to be made? Where do you see the next sort of steps of this? Helen, I'll go with you.
All right. I mean, I try and get up every day being optimistic. I'm optimistic on the progress that's been made. It's not that many years ago we would not have had this conversation at all. Lots of people in the room, thousands of people online. There's lots of interest being generated in this topic, and that's terrific. So that's really positive. But they're like all things. I think when I started my career, I hoped that I would end my career not having to talk about DE&I, and we still are. So it just says there is a long way to go, but we're making steps. I think there's still many horizons to cross the day that everybody can feel like their needs are represented and they can be, feel that their needs are considered is the way to go. And I think I like this topic. We talk a lot about women's health. The topic came up quite a bit around. It is also important to think about men in the equation. Because to your point, some things that you do will benefit everybody, and how they identify also can have some impact. But we talk a lot about messages that are given to women as they're growing up, right? Be perfect, be quiet, be nice, be kind. And we don't talk as much about the impact of the messages that men get when they're growing up. Be tough, be a winner, be a whatever. But that manifests in the workplace. So we can get some better benefit of flexibility, work-life balance for women if men also are getting better flexibility, work-life balance. And we heard that in an earlier presentation of, men also taking advantage of work-life policy. So if we can get that barrier. So we're crossing lots of barriers on women's health. We want to cross some more on men's health. And that will benefit us all.
And Emin, what's the next frontier of this for Scotiabank?
I don't know what the next frontier is, to be honest. I think there's so much to be done, and there's been a lot of discussion today on how do you normalize men taking parental leave? How do you address menopause in the workplace? One of the things that comes to my mind beyond those is it came up in the last panel around the wage gap. I think that's really critical and fundamental. In the federal space, there's been some evolution in terms of providing some pay equity. I think there's room to grow there, and I think that's a very fundamental piece that works towards a lot of things. So caregiving, you have more money, you can buy more support. You are making the same amount of money, so it's not always the woman who's going to take time off. I think some of those things are big fundamental issues that are what we should work towards beyond. I would say it helps encompass across the spectrum versus these specific targeted things as well.
And Stephanie?
Yeah, so many great things have been said. Honestly, I feel like it's stay the course, stay really, really focused, and keep moving the dial. I think back to, we were talking about stigma around topics, be it menopause, mental health, whatever the topic may be. For us, one thing that I always kind of refer back to is mental health is part of our inclusion, diversity, and equity strategy. And in 2017, we started taking some big steps to try to make progress there. And that tone from the top and really having the power of storytelling, harnessing that was really, really pivotal. We put in place a chief mental health officer. That was the first for our firm, but it was also the first in corporate Canada. We've come to understand also, so it's an innovative role, and that person has lived experience with depression, and he was out there constantly telling his story, engaging people, talking about how he accessed resources, and really trying to call people into that conversation, and it made a difference. It had a huge ripple effect. Now we have leaders, people of all levels openly sharing their stories, their experiences with mental health challenges, with burnout, and everything in between. And we've really seen the culture move from that. So I think being able to really draw on some of those lessons around women's health, opening up the dialogue, continuing to leverage the power of storytelling, I think will continue to go far. And again, I think we're on a good path, but we really need to stay the course, stay hungry, and keep moving the dial.
Thank you for that. Do we have time for questions? Yes, we do. Wonderful. Question here in the front?
Hi, good afternoon. My name is Dr. Tina Petrelli. Nice to meet you all, and thank you so much for sharing and for everything you're doing. I guess my question is from a preventative or preemptive approach to wellness within our workforce for women and men. It was clearly articulated in the previous presentation that there's stress within the workforce that individuals are dealing with, and then the fact about the Gen X coming in and already experiencing burnout. From a medical standpoint, when you look at a model integrating the stress hormones, sex hormones, and the central nervous system, and how even simple activities of our younger generation on a cell phone is constantly stimulating a sympathetic response that we don't know, and how these compound. So I guess my question is, having individuals come into a workforce at an early age, are there any strategies, are there any opportunities to really mitigate or be more preventive and preemptive rather than dealing with the issues once they actually really burden our workforce and individuals?
Yeah, absolutely. Yeah,
Yes,
happy to
please.
jump into that. So absolutely, being a company very focused on health, along with other things, because we're asset management companies, is exactly thinking about that preventative. No one understands better than us from a claims perspective of how much better you are by addressing things before they come a claim. And it's a win-win because it's aligned with our purpose, which our purpose is healthier lives, not increasing claims. So it's greatly aligned with that. So we do lots of things, one of which is make sure, and it comes back to this really critical role that the people manager plays. There's so much attribution to everything about your career, your success, your well-being that can be hinged on the role that that manager plays. So in our organization, we've taken away a focus of there's a real critical value of the value chain of having effective managers. I know how to have a conversation. I know how to spot an opportunity, and that's or a need. That's from everything. You think about preempting the mental health issues that lead to potential suicide or worse outcomes. If you could preempt those, boy, have you really solved a big problem. So we focus a lot on that. How do we spot it early? We have benefit programs as well that focus on well-being and wellness to also try and focus that. As a company focused on healthier lives, we put lots of things in place that help to focus on that. And we just need to do more because there's so much in the healthcare system that needs navigation of information for people. So I on this topic of women's health, have also made it kind of my personal mission to say, we all need to work together to make health better. So I'll just stop because I didn't mean to hog the whole speech, but you can see how passionate I am on this topic, so I'll stop. Over to you, my colleagues.
Yeah, I think maybe the one thing I would add is just making sure they have awareness of what's in their program. So we've made a very proactive effort that when folks are coming into the bank, they have a very clear idea of what's there, and creating those advocates and champions for those programs to make sure that that information is reinforced so that it's there when you actually need it. And I think what's actually really helpful is a lot of the newer generation coming into the workforce, they really care about this stuff. It makes it a lot easier if they're invested in it, they're thinking about it. Rachel mentioned earlier, I hadn't really thought about burnout in its context until now. Like, they're aware of it, it's important to them, that makes it easier, and then they become those champions and creates that virtuous cycle. So I think trying to leverage that is really important.
Not much more to add except, yeah, people managers, they have a really big job. And so again, continuing to really make sure that they are supported and upskilled is really important. And we've really been emphasizing that and really making sure, especially as people are becoming new managers, that they are equipped to support and spot the mental health challenges that might be present on their team, and building those trusted relationships. That's absolutely essential. If you don't have those relationships, you're not likely to actually notice if someone is having a challenge. So it all really comes down to that. How are you building trust? And then how do you have the confidence, about what to do, knowing you don't have to be an expert, a mental health expert, but how do you really have awareness of resources that you are confident to connect people into the right resources and give them the right supports? But yeah, it all really comes down to trust. And similarly, we are a large firm. We have new people joining us all the time, thousands, right, every year. And so really making sure that everybody coming in as new hires, we are connecting them to our resources. We have live virtual mental health onboarding sessions for all new hires every quarter, so they're able to join, hear from our chief mental health officer, understand our resources that are available to not only them but also their family, right? A lot of the time, some of the conversations we're having, and again, we're talking about women, right, who are often, thinking about all the circle of people in their life. It's not always just that individual, it's people that they are supporting as well from a mental health perspective. So making sure that we're catching those people too when they're onboarding so that they know how to make resources work for them and their family and their loved ones and their teams.
I think we have time for one more question, perhaps. Oh, right here.
Hi, my name is Suzanne, and I'm with the Canadian Women's Foundation. I'm really honored and happy to hear about the sorts of things that you're doing for your employees and to create that culture. But I'm wondering at a sort of systems level or a healthcare level, what kinds of practices, policies, systems change we need to make sure that everyone can benefit from the kinds of great policies that you're putting in place in your workplaces?
I can, it's exactly right on. It's exactly why we see the benefit of things like the Canadian Menopause Foundation. There's information that's available to all people, and there's much about our purpose around healthier lives, which is for all Canadians. Obviously we gear lots of things to our clients, but very much focused on that. We advocate on healthcare policy lobbies, so continue to do that. And just continue to build the momentum. There's a real opportunity, and you all inspire me I know I'm interested in this topic, but if this many people show up for the session, there's a lot of opportunity, so that also just inspires me to do more.
I don't think I have specific examples of systemic changes, but I think all of these pieces are integrated. So the work that employers do builds off what insurers' programs are, which builds off public programs. So the way we're thinking about it and talking about it now and trying to be intentional and identify what's there, I think that sort of systematic approach is really important. And I think particularly if I think at a government level, my thought is how do you do it over a long-term basis, and how are you thinking about that? It's really easy to get caught up in the shiny penny, but what's the right way to think about it to get to the right conclusion, even if it takes longer than the year or 2 years that you want things to happen. I think that systematic, intentional approach is really important because these are big issues that are complicated that we're trying to address.
Yeah, that covers it all pretty well.
Yeah, I think so.
I think, Lisa, do we have time for perhaps one more question, or are we at the end of our time? It says about a minute to go here. One more, perhaps? Is there anyone in the virtual audience, perhaps, who might want to ask a question?
Yeah, we have lots of questions in the virtual queue, and I just read one about flexible work. The viewer wrote that there's a lot of alarms being raised about empty offices, and so will there be pressure to have everyone back at work full-time, and then what might this mean for burnout in women advancing and so forth?
Oh, I'll answer that because real estate's also in my portfolio. There's just connecting of the dots that needs to happen, which is that it's a mindset shift. We need to stop thinking about office space like we design churches. Full 2 days a week, empty 5, but we designed as if it could be full 2 days a week. So it's also just sort of, it's also changing our paradigm of how we think about office space. And creating the win-win. People also don't want to come into the ghost town, right? So companies, and they also do not, if you think about the value of commuting into the workplace, same way you stopped driving to the mall if you could buy it online, why am I going to drive to the workplace to do the same work I could do at home? So it's incumbent upon us as companies to rethink what that workplace is supposed to be. What work is better done in the office? How do you make that space conducive to it instead of saying, come back to the sea of workstations, that's somehow more compelling as a reason to do it. So I'm clearly passionate on lots of topics. I'll stop on that one too.
No, it's so true. And I think it's really important to give people flexibility and choice, right? I think a lot of what we've been talking about today is really respecting and understanding people as individuals, what their situation is, what they need, what's really important to them, and making sure that we're able to work with them to create a situation that makes sense for them. And being really thoughtful about what work actually is best done in the office, needs to be done in the office, where there's value to actually coming together in person, because there is definitely, we're talking about generations, really trying to, I think we have to appeal to, the next generation to really come in, because they have been so virtual. They've been educated virtually. Their whole big part of their life is digital. So, bringing them into a workspace, we really have to create an appealing value proposition for them, right? So making sure that we are providing that coaching, that mentoring, that connection when we do come together, I think is really important. But for all the reasons we've talked about today, women's health, women's well-being, flexibility and choice, absolutely needs to be really top of mind for all employers as we move through this critical moment.
That seems like a perfect note to end on, unless...
I'm good.
All right. Just checking. Well, thank you so much for this. Thank you all for your time. Thank you for your thoughts. And thank you all of you. Let's give our panelists here a round of applause. Thank you so much. And now it is my pleasure to welcome to the stage Dr. Yolanda Kirkham, an obstetrician gynecologist working in Toronto. Dr. Kirkham is also an assistant professor at the University of Toronto. In addition to her clinical and surgical practice of caring for women and gender diverse individuals of all ages, Dr. Kirkham is a frequent contributor to print, TV, and in-person knowledge translation to reduce stigma about neglected and undertreated reproductive health conditions. Please welcome to the stage Dr. Kirkham.
Thank you. Thank you. Nice to meet you. Thank you. Hi, everybody, and thank you so much for being here today. I feel really humbled and privileged to be speaking to you, and for all of our speakers that have shared their personal stories and challenges of working with all our health conditions. I want to thank everyone in this room, but also those that are here virtually, because you have made a commitment to recognize, not only recognize that there is an issue, but there certainly is more that we can be doing in terms of women's health and how that coincides with our family and our work balance. So I'd like to start off with really talking about why we're actually here and why we are in this predicament. If we go back 2,400 years ago to the time of Aristotle, they were perplexed by women's bodies, and they thought women were men's bodies turned inside out. And they attributed so many diseases that men would have, the same kind of conditions, to female madness, and that it was a psychological cause, or due to a uterus that was wandering around in their body. This term later became coined as hysteria, which comes from the Greek root hyster, or uterus, or the womb. Now, what's baffling to me is that this condition of hysteria, which is used to explain many conditions or emotional outbursts or changes we may experience in life, was not even removed from the diagnostic manual that psychiatrists and psychologists used until 1980. That's in our lifetime. So there's a lot of stigma around women's health topics. I'm going to introduce some words to you today that you might not have thought you would hear at work. So bear with me. I am a gynecologist, so there will be vagina talk. But yeah, we have to talk about periods and hormones. And hormones sometimes are something trendy that people talk about, but hormones are chemical messengers that really manage our entire body. So there are unsexy hormones like the thyroid hormone, the insulin hormone that manages our blood sugar, and then there are the sexier ones from our ovaries like estrogen, progesterone, or even testosterone that we make as well. And what happens with periods and perimenopause is that not only do we have fluctuations, but we also have deficiencies and changes that happen with medication, as well as even normal processes like pregnancy or postpartum. So periods, we have them quite often. We have them every month. And I don't know if you've counted, but we now have about 450 periods in our lifetime. We spend about 7 years menstruating. That is a lot of time. And we're talking about half the world's population. And so that is millions to billions of people. At any one time right now, 300 million people are having their period. So for something that affects so many of us, and also by relation to affecting our husbands, our children, and other people in our work, we really need to be talking about this. Katy Perry recently performed 10 minutes of her amazing greatest hits at the Video Music Awards, and then proclaimed at the end that it was the first day of her period. At the Paris Olympics this year, we had gender parity. And so there was much more awareness about periods with the provision of menstrual products available, but also in terms of their outfits. No more white bottoms. I was really pleased to see in the Globe and Mail offices here that they had menstrual products available in the bathroom as well. So in terms of removing some of that shame and stigma, we need to move away from some of the myths and the misinformation that has been handed down over time. And it is really unfortunate that some of these gender biases still exist, and even in medicine. Denise was talking as a Black woman experiencing endometriosis that, how come she believes that maybe Black women feel less pain? And it is embarrassing to me and difficult for me to reconcile that even in medicine, we have these biases that still can be pervasive. Henrietta Lacks was a young woman of 5 children who had cervical cancer. And to this day, we still use her perpetual cervical cancer cells for research. And there's no recognition for that. Many of the instruments that we use in gynecology were done on women that had no choice and no anesthesia for surgery. And so we need to remember that even these biases are pervasive and we need to make changes. And I am proud that in medicine we're being able to recognize this and start making those changes. In giving you awareness and education about these topics, I'm hoping you can also have those discussions within your family and workplace. And so I'd like to talk about some of the conditions that really might be overlooked and undertreated as well. In a room of so many, some of you might have skin conditions. And there is a vulva skin condition called lichen sclerosus, where you can be very itchy in your genitalia. I've had patients tell me they'd had to run and hide in a room to go and scratch. And so many times, people aren't even examined, and they're just told they have a yeast infection and are given yeast medication. So I do hope you will seek healthcare providers to listen to you and examine you if that's the case. Now, not just with puberty and changes there, but we also have changes in our reproductive life. Some people have mentioned they had difficulty conceiving, and child rearing and child planning is very important for a lot of people. And as women, we do feel a biological clock, unfortunately, with decline. The average age of pregnancy now in Canada is 32. And not only do we have more problems that can arise in pregnancy, but there can be a lot that's physical and emotional during that journey towards getting pregnant. So certainly we have a lot of work to do around fertility. People have heard about egg freezing. And this can be helpful because if you are a single person and if having a baby is important to you, this might be something you want to do for yourself to kind of stop that time and at least have a little bit of less pressure. But sometimes people don't know how much is involved in all of these processes. So for example, with egg freezing, that means a lot of appointments. That means injecting yourself with hormones. That means going for very early appointments to retrieve those eggs. And that's also a transvaginal process which might be very uncomfortable or traumatizing for some people. So we were talking today about how HR might be more understanding of these. And so certainly having that education, having lunch and learn opportunities can be helpful for everybody. When people do get pregnant, they can also have a lot of hurdles. And so not just the infertility journey, which can affect relationships, but people can have pregnancy loss. I'm not really nervous to tell a whole bunch of strangers in this room that I had a miscarriage, but I think my mom is listening today, and she doesn't know that I had a miscarriage a few years ago. And as a busy doctor, I tried to, well, I was very lucky I wasn't bleeding a lot, that I needed surgery, but I tried to manage my miscarriage medically and pass my pregnancy on the weekend so I could be back at work on Monday delivering other people's babies. Luckily, I have very supportive colleagues that I felt comfortable talking to who took my shift that night. So I do hope, you know, it doesn't take someone to have to tell you, but that people can share these experiences, because sometimes it's difficult to share what you're going through, but when you do find out 1 in 5 people have miscarriage, and they will offer up that support when you need it. During pregnancy, people are really nice to you sometimes, but then it's hard planning going back to work. That return to work is also really difficult because, as we've heard today, people have to consider how much time they're going to devote themselves to or how much they're even able to. It took me about 3.5 years to feel normal again after having a baby. That postpartum period is also really difficult. On top of adjusting to a new baby and the constraints on your relationship, there are hormonal changes that can be really difficult. People are always worried about taking birth control pills and some of the side effects with hormones, but the hormones with pregnancy and postpartum can be just as bad, just like perimenopause. So we also need to redefine that postpartum experience and see that it involves a lot of other people beyond just your doctor, but may include somebody skilled in nutrition or pelvic floor physiotherapy for pelvic rehabilitation. It might include exercise training, coaching, and having more confidence in going back to work. As we mature, we also reach perimenopause. And that's a big generation of Generation X and older millennials that are working towards menopause now. And that's the 5 to 10 years before all your ovaries' hormones actually diminish. So that can be a lot of time, and then all of the time after menopause, when you stop having your periods, which can be a yay for many people, you're still living in menopause for several decades after that. So we have a lot of work to do in that space, because brain fog, vaginal dryness, changes in your skin, and not just reproductive issues, but heart health, bone health, disability, chronic pelvic pain, that all comes together with that phase of life as well. Thank you for your nods of agreement. So how can we navigate some of these things? I mean, I'm a gynecologist, so I hope you know, not just gynecologists, but your primary care, nurses, family doctors, nurse practitioners, they're also able to be your first step in seeking care. It's important to have those investigations and discussions so that you know that there is treatment. We also need to rebrand instead of also just redefining. So for example, one of my favorite rebrands is the birth control pill, because all of the birth control options to a gynecologist are actually period control, right? We bleed for 30, 40 years, and we don't actually have to have periods. It's almost old-fashioned to have periods. I have an IUD, so I hardly ever bleed. But the fact is, all of those options, including pills, patches, vaginal rings, implants, IUDs, they're actually period control. So you don't have to be trapped at home bleeding. You don't have to change your weekend activities because your period has come. If you're perimenopausal and you're having abnormal bleeding, where you're bleeding all the time, you need to be investigated, but also you can be treated. And not all of the options are hormonal, because there are also non-hormonal options that work on your bleeding clotting system. Even anti-inflammatories that you can get at the drugstore are a great start to reduce bleeding by 50%. Just take it with food so you don't have stomach upset. So on top of that, I mean, I'm a mom as well. I have an 8-year-old son. I was contemplating, how am I going to talk to my son about periods? And luckily, I don't know how this happened, but last week we were spending time in my bathroom, because as a mom, you never get privacy there. And he mentioned to me, "Mom, do you get periods?" And I was like, "Oh, how do you know about periods?" So apparently he reads 500-page chapter books, so he came across this word. I said, I'm a gynecologist. I help women and I help people who bleed to not bleed so much. So I'm really lucky that I don't bleed so much, but what do you know about periods? And he said he asked Daddy, and that's why we get cake to eat every month. So I did want to just say that, you know, the conversation around all these things are important for women, but also for all our allies. So the men in our lives, the boys in our lives, because they are affected by our health issues as well. And in opening up to them, we will realize that the research is true, that, for example, boys are actually curious and eager to support people who bleed, even if their knowledge about periods is not that good. Now, in terms of some strategies, personally, you know, I think it's important to redefine what success looks like for you in different decades of your life. In your 20s, you might actually be saying yes a lot to different opportunities for knowledge or experience because that's where you want to gain. And actually, that is where we have a lot of energy, I think. When I see my young patients as an adolescent gynecologist, I encourage them to do as much as possible in their 20s. Things get harder and busier as we go. In our 30s and then in our 40s, perhaps we can say no more often and look at what is success for us. Is it more family time? Is it travel? Is it food? Is it something different? And at that time, maybe we don't have to focus so much on striving. Maybe we're almost there. Maybe we change our education, which is now wisdom, into coaching and mentorship and leadership roles that also can help others. Some people have mentioned today giving up positions when they're in their prime of life. I feel the same, but I think we need to divert and pivot and use our skills in different ways. For Janet, I hope now she sees, having given up that job, her new position on Menopause Foundation is really helping a lot of people in a different way, and I hope that's valuable and rewarding to her, for example. In terms of home health as well, so much time is spent at home, which is now bleeding into work, but making sure you have ergonomic seating at your own home and that you're comfortable is really important. Schedule in time for things, not just meetings, but time for a break for food. I'm also a supporter of exercise and nature therapy. Thinking about at work, but also in the corporate world, why not have meetings outside when it's a nice weather, right? Or have spaces where people can enjoy each other and have the opportunity to have these conversations, whether they're difficult or they need to be private. Have space where people can also pump if they need to when they return to work. I was in the operating room on my first week coming back, and the only place I could find was a broom closet in the operating room. So yeah, it was very short-lived pump at work type of situation for me. But things are changing, right? I was at the airport the other day and I even saw this very interesting pod that was specifically for pumping. So I'm glad there's some awareness there. And then personally for me, I found that commuting was something that was really driving me crazy. When I hit my mid-40s and I said to my husband, I'm going to cut things out that really annoy me. And he asked if he should be worried. But it was the commute into Toronto that was really killing me. And, you know, we're inert beings. We don't really want to change things because it can be really difficult. But I changed that. I moved my office from downtown closer to where I live. So now I can see my kid for a family sit-down meal. I can be there for activities. I feel like I have personal space, not running between places and spending time in a car that I don't need to be. So think about these changes where they can be made. I used to do half-day clinics, and then I was like, well, why don't I go fewer times but do a full hour clinic instead? So there are definitely changes that can be made. In the workplace, people were asking about different options. We talked about spaces, but also education. I was surprised and I was really happy to speak to the cafeteria staff at my hospital who asked for a discussion on perimenopause. That was awesome. People opened up about their own experiences, they felt safe, and it was just a regular thing that they did, and they had a speaker speak to them about something that was important to me. So we had a question on this side of the room about education, and I think that is a great idea to normalize health conditions by talking about them at work. As physicians, we're asked to fill in a lot of forms required by HR, but we're not trained in that. And so if you want to help our healthcare system, perhaps HR can minimize the number of forms we have to complete. And we're also asked to fill out a letter just saying the due date of a pregnant person. And I think we can believe people, and they know their due dates. No, but I really appreciate this discussion. And I think on a personal level, too, when you go see the doctor, there are some tips in terms of what you can do to make that healthcare encounter more valuable to you. Today's personal stories have been really helpful. So making sure you describe your health condition in how it affects you and how it affects your quality of life will help you be heard. It is unfortunate, 85% of women feel that they're not heard. And in emergency rooms, for example, women will wait 30 more minutes than men for pain medications. So these biases still persist. In terms of work accommodations, having mentors or support networks is also important so that you can see how other people have gone through these same processes. And certainly having the opportunity to speak about these without fear of retribution or being thought of as less capable is really important. They did a very interesting study where a woman would drop either a hair clip or a tampon on their way to the bathroom, and people that dropped a tampon were seen as less capable at their work. So there are interesting perceptions that we also have to overcome, and hopefully by talking about them and incorporating them into how they affect us is going to make a big difference. I did want to mention a couple other things in regards to menopause, and that is in regards to some conditions we don't speak about, which is genitourinary syndrome of menopause, such as vaginal dryness and sexual pain. And you're wondering, why are we talking about this at work? But this can also affect your relationships. And we know that anything affecting you at home can affect you at work. And so another thing that could be helpful at work is if we could be as lucky as on the show Billions and have an in-house therapist. Certain institutions like universities also have on-site student health, and I know a lot of corporations also have privatized care available to them. It's also important to know where you can seek help. So for example, your issue, you may not need an emergency room, but you may not be aware there is an urgent care in your area. If you don't have a family doctor, walk-in clinics, they are family doctors not yet setting up their own shop, but sometimes they're working there for a while and you may have continuity of care there too. So that's another area you can seek help. So I really want to thank everybody here today for the discussions and your interest in talking about women's health at work. It's really about redefining and rebranding. We need to celebrate our small wins, our safe havens, our challenges, and our allies, and in this way come up with new, meaningful attitudes and changes that bring on autonomy, respect, and compassion. Thank you. I don't know.
This is on. Thank you so much for that. That was great.
Welcome. Thank you
Yes. I would have liked to have been in the room when the geniuses of 2,400 years ago decided that women's bodies are just men's bodies turned inside out. On behalf of the Globe and Mail, I would like to thank Sun Life for making today's event possible. And on that note, please welcome to the stage Jessica Tan, Sun Life Canada President, who's going to summarize some of the key takeaways of today.
Hi, I'm Jessica. First off, thank you very much to Erin and all our Globe colleagues and friends for organizing this. As some of you may know, I'm very new to Toronto in Canada. So I've only been here 1 month, but this is just refreshing. Very, very refreshing. I'm glad I canceled all my meetings, and I think the past 3 to 4 hours is just really, really inspiring. To summarize is really difficult. So I thought there were 2 things that kind of really resonated with me today, and I thought I'll just share it, and hopefully, you feel the same. The first one is, this is a real issue. It's a real issue. If you're not convinced by numbers, you might have forgotten what Liz from McKinsey kind of showed. So I was blown away by a few numbers. So I know I've been in healthcare for 10 years, getting into that. I know that women generally live longer. So I always joke, we are a family of women. I have 2 girls. My sister has 2 girls. Everyone was like, okay, we live longer. So I know proportionally, therefore, the last 10% of your life typically is in, chronic conditions and disability. But her chart showing, we just suffer 25% more. That just blows me away. That just blows me away. And also, the other number that resonated with me was how, we have, I think she said 56% of these conditions that we suffer disproportionately more. And only 5% were the so-called women-specific issues that actually we spend a lot of time talking about. We haven't even talked about the other 51% that we actually suffer more disproportionately. And I think there's lots of things to do. So you're not convinced by numbers. I'm sure you were convinced then by, I was just incredibly blown away by our first panel. I think, where's Denise? I think she's going to be in my mind forever. I don't know where she's still here, but I think all of us will remember Denise. We'll remember Shana? Correct? Yeah, Shana, that's correct. And as well, Janet. Read their stories, was really inspiring. And thank you for sharing your personal stories. I think you made a huge difference making this a safe space. What safer space? This is public, role modeling. And then hopefully in our careers, I hope that we all, as individuals, as leaders, business and people leaders, that we never want to make that same mistake again. It's going to stick in my mind forever. So I was incredibly inspired by that. I was inspired by kind of employers. Thank you, Helena. She's really our champion, sponsor, advocate, ambassador for this. She's really. I tell you, she's got all of us here, including Chris. All of us clear our calendars. We're here. Our clients are here. And I was also a beneficiary of this. This is my 5th week here. Actually, the first 2 weeks, some of you might know, actually, I was in pain. So I was bedridden and on a wheelchair. But I think I really I had to do a little training. One of the training that I have to do, because I was, was how to have a conversation about, your personal situation. What do you have? Because it's a very delicate balance you have to do. You have to listen and empathetic, but you can't rush in to solve everyone's personal issues. So that was one of the training I have to do, and I was very grateful that I really felt embarrassed that I wasn't able to come. My husband said they didn't hire a kind of bedridden president. You should really go to work. But Sylvia knows, Simona knows, I really was so much in pain. I can't imagine Denise suffering for 20 years. I was just 2 weeks and I just want to die. So they knew I was at home. I had to Zoom call. Sometimes I couldn't even sit. I had to do lying down. And I thought about it. Oh, should I share it? Do I switch on the camera? And I thought, it's okay. And it's really okay. I've been very supportive colleagues, supportive team. And I think it speaks to, the culture that I think Helen has championed, that we are really supportive, really really live, to try and create that environment. I'm proud to be of this organization. So I'm really excited. Today we have so many employers here, men and female alike. I think Brad from CIBC, we have Scotiabank, we have KPMG, we have so many people who's interested in this. So I'm encouraged, I'm motivated and inspired that I think we will do great things as employers. And then finally, I'm inspired by actually some of the folks. I think Dr. Yolanda should just be the advocate for all our GPs and your family. I wish I have her as my doctor. You're just wonderful. You should do a training class for every other practitioner. I'm mostly Swati. She's from our dialogue team. As a young kind of practitioner, she sets up her own kind of startup and now part of dialogue team. We're focusing on women's health because we have to change the system. We have to change the system. I think it's not just ourselves. I think as employers in the workplace, but also the whole healthcare system. And I'm encouraged that we have actually folks within the healthcare system who understand simple, plain lingo and can make this work. And so I'm of the same view that I think I'm optimistic. I hope I wish my girls are here. My eldest daughter is big on this. This thing is big on youth. She's all about mental wellness for youth and for girls in particular. So I wish she was here. I think we will do great things. Hopefully this is the beginning and we're ecosystem together. And I look forward to greater things. Thank you.
Thank you. Oh, am I on again? Thank you, Ms. Tan. That brings us to the end of our event. Thank you for everyone in our live audience for coming. Thank you for everyone who joined us virtually. I am reminded to tell you that we'll be sending out a recording of today's event in the next week or so. And on a last note, I would just like to give one last round of applause to our speakers. Everyone was really great. It was fantastic. And thank you all for coming. Have a great afternoon, everyone.